Ladies and gentlemen, please take your seats. The general session will start in 1 minute. Mesdames et messieurs.
Ladies and gentlemen, please take your seat. The general session will start in 1 minute. Please take your seat.
Good morning, everyone. Bonjour. Buenos dias. Welcome back to the 92nd General Session. Thank you. We hope you enjoyed your evening, and please make sure to have your headset ready, because we're about to start the final section of the Animal Health Forum. And some of you may have been thinking about our discussions from yesterday. Mariana, has this made you reflect for any changes for veterinary vaccination?
Always a good question then, and my answer will be yes, yes, and a huge yes. Yesterday we have explored how you, WOAH delegates, and other stakeholders manage the decision of vaccinating. We have also heard the discussion regarding the challenges of production. We have listened to how to improve the current mechanism to facilitate the procurement process and consequently have what we all want, high-quality vaccines. And finally, we discuss about the critical elements to design a cost-effective vaccination campaign as part of a sustainable disease control.
And now we are wondering, what are we expecting from this disease control tool? What are the desired and undesired consequences of vaccination?
Exactly, Dan. And this is why we arrived to our 5th technical session. We will explore the desired and undesired consequences of vaccination, with a strong focus on trade and impacts on societal acceptance. To answer to your questions then, panelists will discuss how vaccination can affect, vaccination decision can affect international trade, potentially leading to some unjustified trade restrictions.
That's right, Mariana. This session will also address societal concerns, examining public perception and the challenges of gaining widespread support for the vaccination programs to manage disease, a point that came up many times yesterday during our discussions. And because you are the main actors in this series, we have a final question for you to get your thoughts.
And the question will come in the form of a Mentimeter, so be ready with your phones to answer this last question about the forum.
So the question is, which of the following most influences your decision to implement a vaccination program in your country?
Ooh. And the first option is 1, avoid massive stamping out, 2, societal acceptance for animal health control measures, 3, access to international market, 4, improved economic cost benefits of the disease control. It's your turn to participate in this Mentimeter.
Results are coming in fast. What do you think, Mariana? Which way is it going to go?
I think that our rapporteurs look really interested in the answers.
Could it change?
It's moving, it's moving. The question is, which of the following most influences your decision to implement vaccination program in your country? We want to hear from you. It's moving, but I think we have a majority then.
I think so. And most of you have selected improved economic cost benefits of disease control.
Mm-hmm. Well, thank you very much. Whoa, 408%.
Wow.
Thank you. Thank you very much for this. So with these interesting results, now we come back to our new WOAH member, Norland, that you have heard in the past 2 days. So we are going to see the final episode of our series. Let's see what is happening in Norland since yesterday.
The situation today is that our trading partners are imposing bans because of our vaccination policy, and that is something that can go against all the recommendations of international standards. Without vaccination, our livestock population is at serious risk. So we do need to protect them. We need to protect our national food security, but at the same time, we have to maintain the international trade relationships.
It seems contradictory to have the technology and the knowledge to implement sustainable disease control strategies, yet they're not used due to indirect and, on many occasions, unjustified barriers. How do you navigate these competing pressures?
Well, every decision has ripple effects. While some countries will accept vaccinated animals and their products, others won't. And that is why we need to have open discussions alongside our disease control efforts to make sure that our farmers are not left behind, and also to make sure that we are making the best use of all the available disease control tools to ensure that we are protecting animal, human, and environmental health.
But international trade standards aren't always respected. If we push back against trade restrictions, there could be long-term consequences. So in the end, is there a perfect solution?
Unfortunately, no. There is no solution that will fit all the scenarios. But our decision has to be based on science. It also has to comply with WOAH international standards, and it must also consider all the socioeconomic context. And this is the only way that we can make sure that we are implementing sustainable control disease efforts to protect everyone's health.
So that was our last video from our fictional member of Norland, and you heard the CVO's words there, that a decision has to be balanced based on science, WOAH standards, and socio-economic consequences. And interestingly for these videos, only one of the participants was a professional actor. The rest were all WOAH staff members. So if any of you are making any films or videos, yes, thank you. Thank you so much. If any of you are making any films or videos, please do consider hiring our staff before Hollywood snaps them up. And now I hand the floor over to Dr. Donadeo. Thank you.
Good morning, everybody. So welcome to this session number 5 on trade and social acceptance. If we can have the slides, please. Okay, so we have heard a lot about the benefits of vaccination, but we also need to consider the undesired consequences of vaccination. And the main one that we have been discussing is about trade. So various WOAH terrestrial code chapters, they provide science-based guidance on the safe movement of animals and their products from countries or zones that are practicing vaccination. But because of the lack of DIVA vaccines, or for other considerations, the standards do not recommend vaccination for a country or zone if a country or zone wants to be considered free. And according to the World Trade Organization, a country's sanitary measures should be based on the WOAH standards, as we heard. If they are absent or a country wants to implement higher levels of protection, it should be based on risk assessment and bilateral agreements between the trading partners. And we also need to consider what are the alternatives as stamping out, because also that has a very important socio-economic component. And talking about the socio-economic component on vaccinations, we need to consider that the community might demand alternative control measures, because they might have fears of vaccination, because they don't have the adequate knowledge, etc. So it's very important to consider public perception, and we have been hearing this again and again, and the importance of communication. We also need to consider the cost for the community if the vaccination is compulsory, or if the lack of vaccination or vaccination limits the movements on markets. The economic impact assessment should include cost-benefit analysis, not only at country level, but also at end-user level. and at different levels of end users, so need to be from commercial to livelihood farmers. And we need to consider for each of them, national and the different levels of farmers, the different scenarios, including the status quo. So with that, we are going to start now this session. I'm sure you're looking forward. And it's my pleasure to invite the moderator, Dr. Mary Van Andel, who is the CBO and WOAH Delegate for New Zealand and WOAH Council member. Please welcome her.
Good morning, everyone. It's a great honour to be here today to chair this session on this complex topic that affects all of us. Here to guide us, we have a great panel of international experts. The first I would like to welcome to the stage is Dr. Gaston Funes, the Vice President of the WOAH Terrestrial Code Commission in charge of the Agriculture Office at the Mission of Argentina to the European Union. Secondly, Dr. Ronaldo Alcala, who works as a counsellor in the Agriculture and Commodities Division of the World Trade Organization, where he focuses on the agreement on application of sanitary and phytosanitary measures. Welcome, Dr. Alcala. Mr. Felix Metzger is the current president of the International Veterinary Students Association, and he is here to represent the next generation of veterinarians. And finally, known to all of us, Dr. Emmanuel Souberon, the Director General of the World Organization for Animal Health, who previously served as the head of the French Veterinary Service. Welcome, Emmanuel. Right. So without further ado, we're going to start. So my first question is for Dr. Funes. When we consider vaccination from a trade facilitation point of view, how can WOAH standards be further strengthened to promote vaccination as a safe and reliable tool for disease control without jeopardizing international trade?
First of all, let me thank you, WOAH, for inviting me to be part of this session with some esteemed colleagues and also with Madame la Directrice General. Merci. In relation to, sorry, it's impossible to read here. So to begin, let me take the liberty, with all due respect to the General Assembly, to convey a very first direct main message, that probably this message could be the final conclusion of my intervention, but I decided to do at the very beginning of the panel to frame the discussion on vaccination, trade, and standards. I think that it is very important for WOAH members to adopt new standards, as it will be the case here in this general session tomorrow and on Thursday, when the presidents of the Code and the Aquatic Commissions and the manual will present to you new text. But even more important is for WOAH members to adopt these standards when trading, considering that WOAH standards render commodities safe. There are some times that those standards are followed and applied, and this is good, but there are some times that they are not. And depending on the epidemiological situation of each country in relation to different animal diseases, some countries apply stricter or additional requirements and conditions beyond WOAH standards, but without carrying out a scientific risk assessment as it is established in the SPS agreement. Vaccines is a key tool for prevention, control, and eradication of animal diseases, among other benefits such as reducing the use of antimicrobials and benefiting of animal welfare. But if we talk specifically to trade, vaccination is a key risk mitigating measure for safe trade, along with other complementary measures such as quarantine, biosecurity, testing, zonification, compartmentalization. So we have to consider vaccines when trading if vaccination is established within the standards. As it was said yesterday, the WOAH manuals and WOAH codes contain a specific standard in the case of the manuals, clear standard for the production, the control, the validation, and the registration of vaccines. And the terrestrial code contains both a general horizontal chapter, chapter 418, considering all elements of a vaccination program, and then several disease-specific chapters addressing also vaccine and vaccination. Even for some diseases, when a country or zone is considered to be free, that means that for some cases, vaccination does not imply the free status. So we have to consider the use of vaccination when trading. This is important, also with other additional measures. Then, if we talk in relation to the standard setting process, WOAH standards are the result of a rigorous scientific risk assessment with discussion of several experts, both from the WOAH Specialist Commission, WOAH Specialist Commissions. We discuss in our meetings between the different commissions, between the Scientific Commission, the Biological Standard Commission, the Terrestrial and the Aquatic Commission, but also we get inputs from many experts from other groups and from working groups, and also from WOAH reference laboratories and collaborating centers. But equally, or more important even, are the contributions and the inputs that we receive from you, from WOAH members, because you have the experience and the knowledge how to apply these procedures and this method in the field. So we need your input. But this is why when you arrive here to the general session to adopt new standards, it is important that then we apply those standards. There were some cases when some dispute settlement arising at the WTO level, but always the panel of experts at WTO level ruled always in favor of the party that was applying WOAH standards. But we have to avoid this situation. We have to avoid reaching a panel at WTO level, so we have to agree between members, between WOAH members when trading, and to use all the standards, the general standard in the code, the specific standard in the disease-specific chapter, and also the standards in the manual for agreeing the sanitary measures for trading. I hear yesterday the delegate from France, Marie-Christine, when she said that the implementation of vaccination in DAX for avian influenza had no impact in the main markets. That is very good, but this not always happen. And also yesterday in the quiz answer, 10% of the answer were asking for more useful WOAH standard. Even if it was the less voted option, I think this is not a small number, so we get the message and we will continue working to improve WOAH standards. And for finalizing, don't take me as a vaccine lobbyist, but a strong vaccination supporter, considering that WOAH members should apply WOAH standard without disrupting trade, even if such a standard consider vaccination. So this is my main message. Thank you.
Thank you, Dr. Funes. Next question is for Dr. Ronaldo Alcala. If we consider some of the ongoing global transboundary animal diseases, for example, avian influenza, foot and mouth disease, PPR, and other vector-borne diseases, do you see vaccination as a trade facilitator or as a trade barrier?
Well, thank you very much for the question. First of all, I would like also to thank WOAH for the invitation. I have to say that the sessions in this forum have been extremely informative and have allowed me to really understand what is behind the scenes or behind all the elements to take into account when considering the vaccination decision. So, because for us we have only the angle of trade, of course. Now, to address your question, I will start with the role of WOAH in the WTO. And I think Gaston has already mentioned a lot. So yes, the WTO deals with rules of trade for helping producers, importers, and exporters to conduct their business. The WTO addresses the trade-related animal health risks through the agreement on the application of SPS, sanitary and phytosanitary measures, the SPS agreement, which requires that measures be based on science and not more trade restrictive than necessary. Now, while the SPS agreement strongly recommends the use of international standards, the WTO itself does not develop such standards. So WTO members have designated the WOAH as the international reference body for standards on animal health and zoonosis. So harmonizing national regulations with WOAH standards, including on vaccination, helps ensure that the measures are based on science, the least trade restrictive, those promoting safe and smooth trade. So to answer your question, if you apply the standards, you should be complying with the SPS agreement, and you shouldn't be facing such restrictions. But of course, the issue is much more complex than that. Now, what happens when a government believes that the import restriction of another partner, the import restrictions are not based on science and restricting its exports unnecessarily or unjustifiably? Well, there are mechanisms, a variety of mechanisms available the WTO to help solve trade concerns. Members can raise a specific trade concern in the SPS committee, or escalate to a more formal dispute. So to give some numbers, since 1995, there have been 604 specific trade concerns that have been raised in the SPS committee, and about 1/3 of these STCs related to animal health. Interestingly also, half of them, 50%, or as much as 80%, if we look at the last 10 years, involve questions on whether the national measure was based on the WOAH standard, including on zoning and vaccination. Now, regarding the more formal mechanism for disputes, WOAH standards have also are also frequently referred to, and they are key to they play a key role, in the resolution process. So I will stop here. Maybe later I can enter more into details on this if we have more time. Thank you.
Fascinating. Thank you, Dr. Alcala. Our next question goes to Mr. Felix Metzger, representing the future of the veterinary profession here today. So if we think about the progress in veterinary science and vaccinology, how do veterinary students today see the role of vaccination in achieving sustainable disease control? And then when you think about that one, as a future veterinary professional, have you got any thoughts about how we can effectively combat misinformation and disinformation in today's society that's so influenced by social media?
Thank you very much for the question. I'm also very honored to be here today. As you can imagine, as a student, this is quite overwhelming, but I'm also very thankful for the opportunity to represent all the IVSA students. So currently, IVSA has thousands of members in over 80 countries and more than 190 universities. And yeah, I'm trying my best to represent their opinion. So in order to do so, I made a quick survey in my team of officials, so our board, which is also represented by various countries, to identify, hey, what are we thinking about the role of vaccination? And the good thing is, 100% agree that vaccination plays an important role in sustainable disease control. Besides birth control, improved research, education, AMR, all of them see that vaccination is there to prevent, because preventing is better than curing. One of the main things we learn in university. And also 60% in this survey said that they would wish that vaccination is even targeted a bit more in universities, which is quite hard given how packed the curriculum is, but there's obviously a need and interest from student side about vaccinations. It's also for us a way to prevent future suffering. As I mentioned, like we want to prevent things, we don't want to deal with the outbreak when it's too late. So we really see the importance of vaccinations. To answer the question how to combat misinformation, disinformation, this is really not an easy one. And I think the first step would be to just acknowledge that misinformation, disinformation will always be there. It's nothing that we can get rid of because it can easily be spread. So I think that seeing what WOAH, for example, is already doing with their guidelines, updating them, promoting them, is a very good first step, because those guidelines help us to maintain this international conversation about high standards. Nevertheless, it's also about how to promote those guidelines. So of course, social media plays an important role, and it's important to sometimes kind of use what is already there. So a lot of misinformation and disinformation are based on strategies, using influencers, using like short videos, not focusing a lot about science, but rather just spreading the information. So this is also something that can be done with good information, like with actual knowledge and scientific facts. So we should not be scared to be confident about the knowledge we have, about the research we do, because we can be proud of that, and we also need to train students from a very early age that we can be proud of this confidence, and we can use it in communication with owners, but also in general communication, and also potentially ask, use social media and influencers to address this, because why wouldn't we when the other side is doing it as well? The other problem is that we always need to maintain easy, accessible information, because as much as I love science, as we all do, sometimes it can be hard to understand. So we should never forget that, coming back to the words communication, that not everything is understandable for everyone. So going back to the social economic aspects of the discussion today, it's really important that we also think about how the public receives information, how they process this information, and to put this into account when talking about vaccination and disease control.
Thank you. I think the future is in good hands. No? Right, and finally, Dr. Surveillon, how does the 8th strategic plan aim to include vaccination into a broader vision for sustainable and resilient animal health systems?
Merci Mary pour la question. I will.
Thank you, Mary, for your question. And Dr. Souberan is going to speak in French, so she is giving you time to put your headsets on. Juan Felix, congratulations. You said that you were a bit nervous, but no, you're not. You're so good, even though you might be a bit nervous. And stress, trust me, never goes away regardless of your age. So trust me, You'll still be stressed in a few years' time. So, as we said on many occasions, vaccination is not the golden bullet. I mean, it's a wonderful tool, but amongst many other tools that we can use to control resistance to antibiotics and to control diseases. But this debate that we had about vaccination took us on a journey during which we talked about sustainability, and this on many occasions. And these questions around the sustainability of a farm and the way we can control animal health, I mean, all this is something that we need to address within our 8th strategic plan. Our core business, as Gaston said, is to draft standards and to write standards, which are then recognized by the WTO. And I think that in the future, our organization should be capable of writing standards that will make our vet services more resilient and to help them deploy sustainable strategies to combat animal diseases. We have to fight against climate change, against food waste, in a context where we see emerging diseases, but we also see progress in the field of vaccines and AI and technologies. And all this will bring us to rethink our disease-fighting strategies. And we need to take all this into account when we work on standards and when we work on global strategies with our international partners like FAO. So yes, these are questions that we need to ask ourselves to include the dimension of sustainability, because as we said, vaccination helps promoting sustainable animal production by reducing the burden of diseases, by increasing productivity, and by decreasing the impact of the livestock industry. And that's a prerequisite, because we have to increase the production of animal protein in order to feed the global population, but we also need to reduce the impact of the livestock industry because of climate issues. So obviously, this 8th strategic plan will have to address these matters. The last 2 days also led me to thinking about a certain number of issues which are directly connected to the role of WOAH and how we support research and innovation, and how WOAH can be a catalyst in order to set up bridges between members and between members and those who produce scientific knowledge, and between members and those who produce vaccines. Do we need to have more vaccine banks within WOAH? Before a dispute gets to WTO, should ARMSA be kind of an ombudsman and should try and be a go-between between the parties to help resolve a problem? So these are the questions that we need to ask ourselves and address within this plan.
Fantastic, thank you. Right, so we're going to move to a roundtable part of this session. And so I'm going to open with a question for everyone. So for those diseases for which effective vaccines exist, for example, foot and mouth disease and avian influenza, what are the main challenges that countries face when aligning national regulations with WOAH's standards on vaccination? Who would like to begin?
I can try to start. Well, I wouldn't say that this is the main challenge, but certainly a major challenge, and this is something that has already been mentioned in this forum. It relates with coordination, domestic coordination. Implementing WOAH standards require strong cooperation between veterinary services, health, trade ministries, and also other finance, IP offices, and the private sector, of course. So this helps to better understand the measures and the impacts and so on. And also there can be limited awareness and understanding of the SPS agreement and its emphasis on the international standards. So now, perhaps to respond, well, that will be my major, contribution to this question. Perhaps, of course, there are other challenges. Maybe the other speakers can jump in.
Yes, following the comments from my colleague, I consider that something very important is, and remarking what he said, is a very good understanding between the government and the industry and the farmers. Sometimes depending on the disease, sometimes depending on the potential trade impacts, and I will repeat, not because there are no very clear standard to trade, even vaccinating, but in real life, some implications could undermine the decision to vaccinate. So you have to balance, and also the cost, if you have the logistics, if you have enough vaccines, if you have a good vaccine manufacturing industry. So there are many factors that you have to consider when deciding whether to vaccinate or not.
Français.
Switching back to French. I started thinking that, okay, I have enough vaccine doses, I have enough staff, I have enough money. That's my starting point to ensure surveillance, which is already quite a lot. But in that case, the main challenge is the fear of consequences on export markets. And that's unfair, but I'd like to focus on the word fear, because sometimes you'd be afraid before things start hurting you. And I think we should not fear an embargo if we comply with WOAH standards. Okay, all this is very easy to say, I know, but to avoid this, we need to provide evidence that we comply with WOAH standards. We need to establish trust with your own vet services. And that was said many times yesterday. We have to communicate, we have to explain, and we have to be transparent. But I think what we need and avoid is to not do something out of fear. And this is exactly what our young colleague was telling us before. Don't be afraid. Have faith, have confidence.
Thank you very much for the nice words and also the support being on this stage. So I think with those regulations and how to align them, like, first of all, I really appreciate that you already take into account the confidence and to not be feared, to not be scared. I think what I learned being part of an international association is that cultural differences, but also the communication about them can be very hard sometimes. And one thing that really is sometimes not considered is that the middle way is sometimes better than you think, especially facing such a discussion, which is like quite hard to face. Even like the middle way of this discussion leaves us on a higher like status, like on a better foundation for the next discussion. So it's already an improvement. So I think when addressing those concerns and on how to do this, I think it's really important to also look specifically into the countries to be confident about those international standards that we have, but also to address and listen to the specific problems country by country. And because sometimes the problems from one country are quite similar to another one, so you can already take those into account quite easily. But overall, it's really important to not just proceed without sometimes giving national regulations also some time to adapt, to think about it, and again to also communicate about it, like what is easy or like achievable for both sides.
These are great topics to talk about. Perhaps some concrete examples can help us to, think deeper about these. So, Gaston, I wonder, can you share Latin America's experience to offer to other regions striving to balance foot and mouth disease control through vaccination with trade imperatives?
Yeah, thank you. I will switch to Spanish. Sudamérica cuenta con una vasta experiencia en lo que es.
So, in Latin America, we worked on the control and eradication of certain diseases through vaccination. And one example was classical swine fever or FMD. And what was very important was a good coordination between the private and the public sector. We organized vaccination campaigns with involvement of private vets, farmers, local communities, all this under the supervision of the official vet services. And in Latin America, many actions and action plans are being defined. But what's also important to notice is the role of the vaccine manufacturing industry. And they provided high-quality vaccines thanks to the certification of our laboratories. So we produced vaccines to face any potential pandemic, and we managed to have very good vaccines for prophylaxis vaccination. So we managed to protect the herds. And we had another type of approach. We went for biological surveillance. So we had an active and passive surveillance system. We monitored whether the vaccination campaign had been efficient. We took samples to check the level of antibodies. We also implemented vaccination. We looked at the zones to see which zones were disease-free and which zones were not. And we worked with various regional organizations to fight against foot and mouth. And we managed to eradicate foot and mouth. And South America is almost totally FMD-free, either with or without vaccination. And talking about trade, all these programs were audited by the most demanding markets, and our programs have been approved. And now South America can export meat even in those countries which are the most demanding in the world, hence the importance of communication.
So our next question, can we think about how greater transparency and scientific evidence support the acceptance of vaccinated animals and animal products in international markets? Picking up.
So, as I mentioned earlier, sometimes science is not using the language of the public. So even though we have this scientific evidence, it sometimes may not exactly what we need to support what we to reach the acceptance. So I think social sciences need to be involved in this matter to also understand, like, okay, is like at the moment, do we need just the facts, or do we also need to involve and evaluate the emotions of the situation to achieve a better outcome? Like we think social sciences will help to bridge between politicians and the public, because scientific evidence alone cannot change the willingness to accept the information. What could help there is when to start implementing this like support, the scientific evidence. So as I mentioned earlier, we think students should be involved from a very early stage, because at the moment, like when you study, you get into the job, and then you get confronted with national regulations, with regulations at all, and also with all the facts. It can get quite overwhelming, and then you may miss to use those international standards that are already there to think about those international collaborations. So I think also students can be involved more in order to help bringing this information, the scientific facts, to the youth, to other students, to the young generation, because it's way easier to work with facts in a generation that already got confronted with those facts and those problems, instead of like starting this from zero.
Sí, solo para complementar, quiero volver a...
I fully agree with what you said, and I'm going to say once again that scientific evidence is mandatory to write standards, but one of the great benefits is practical experience if you want to be able to implement the standards. And this is going to depend on the local situation in every country. And this is why in the Commission for the Codes, we ask, in which I work, we ask members to be very proactive, because they're the ones that have to implement the standards. So it's all very nice to know how a virus behaves, but then there are the practical aspects, and this is where societal issues have to be taken into account when we draft standards, if we want science to be useful and if we want to be able to implement science.
Yes, more transparency, greater transparency, and the use of scientific evidence, of course. But it's key to building trust between trading partners and vaccinated approaches and facilitate safe trade. And just to say that, yes, transparency, like also in the WOAH, it's a fundamental principle in the WTO, and in particular in the SPS agreement. There are notification obligations. Members are obliged to notify draft regulations of SPS measures, so before they are implemented. So this allows to have comments, to receive comments, to have conversations on the measure, to better understand the measure, and if necessary, the member taking the measure can also consider the comments and possibly change the measure. So all these can contribute to reduce also uncertainty and prevent unjustifiable measures.
Dr. Subayan, what steps can be taken at the international level to increase transparency and trust around the trade of vaccinated animals and of products derived from vaccinated animals?
Merci.
Thank you for this question. Before I say a few words about science, we are an organization that produces standards based on science. And this is what gives us credibility, by the way. So science is the alpha and omega of everything. And by the way, I'd like to thank all the experts working with us, whether in reference labs, collaborating centers, specialized expert groups, working groups, etc. Another thing I wanted to say is that it's important that our standards can be adapted based on science and are not obstacles to innovation. But now answering more precisely, more specifically to your question, I believe that, well, there is many things that we can do. First, like Gaston said, we need to promote a better understanding of international standards, meaning that we must always get members better and more involved in drafting standards, in selecting the standards that we're going to work on. And once the standards have been adopted, which is what we are going to do tomorrow, we have to get them involved in the deployment and implementation of these standards. And then we have a role to play in monitoring all this, thanks to the observatory that was set up a few years back. But as I said, we have to continue updating our standards so that they reflect the latest scientific evolution. And last thing, and that was said by our colleague from WTO, our members have a notification obligation, which is very important. So they need to notify when there is an event, an outbreak, a case, an emergence. But they also have a notification obligation when, you know, you have the 6-month reports, the annual reports, and all this is very important as well. And this will also help us improve our reports and improve the quality of the information that we circulate amongst all our members. Another important thing is to strengthen official vet services everywhere in the world. If you want to have trust in these services, they need to have the capacity they need to take action. So we continue assessing the performance of the official vet services thanks to the PVS tool. And then we need to continue supporting countries and obtain funding either at domestic level or with donors. And then we also need to be a platform and foster exchanges of good practices in order to share experience, good practices, challenges, so that we can inspire trust and then move towards disease eradication. That's it.
Great. So the final panel question before I ask you to sum up. What innovative approaches should we envision to promote broader acceptance of vaccination programs?
So to answer this question, maybe I should start with the question, are we, or like our future vets, or the next generation, prepared enough to integrate vaccination? And looking at the curriculum and the health aspect, I would say yes, we are. We learn a lot about it, we learn about the importance, and we are ready to involve it in our work at a later point. However, those economic aspects, those cultural differences, like country differences, it's very hard to understand while you're in university, because you just get confronted with the science and like, okay, there's this disease, there's this vaccination, it helps, so it sounds good, but the complexity of it does not get that clear, so this is something you learn in the process. So when it comes to ways how to solve this and how to deal with the situation and innovative solutions, I first of all have a rather less innovative solution, which is just like mentoring programs. I think those are, like, everyone is aware of those. And if each of you mentors 2 students in your life, and those again mentor 2 students in their life, it already helps a lot, because university is not enough to prepare us for what we are facing. As you know, this is those are very difficult topics. So mentoring programs are definitely something we should emphasize on. And when it comes to rather innovative solutions, I would like to give a very Gen Z-like answer, which is, as I mentioned earlier, social media, influencers, trends and challenges. Like, really analyze what is going on in the within the youth, what is something that you can easily reach a lot of people with, and just go with the flow. Because again, for those things are used by those that, for example, spread misinformation, and these are good tools, because a lot of times, I'm not sure if you noticed, negative information is always spread in a rather fun way. To give an example out of my personal life, when I'm with my roommates in our flat, I sometimes make up random facts, but I tell them with such a confidence that they believe me. And afterwards, they look it up and say, hey, you lied. Like, yes, I did. And so don't worry, I'm not lying to you today. But I think this confidence and using those techniques that are modern, they are reaching a lot of people, should be used by us as well. And I think this simple change is already very innovative, given given the social aspect of the world.
Gracias. Sí, yo más que hablar de solución.
Yes, thank you very much. So instead of talking about innovative solutions, like our young colleague veterinary Felix said, what I think we should do with regard to vaccination and the different approaches to vaccination, there should be a change in the paradigm. The WOAH Forum in this is really moving in this direction, and I think that there are countries that perceive vaccination as a risk factor instead of perceiving it as a risk mitigation factor. And for many diseases, we still haven't found an effective vaccination, like for that's the case for African swine fever. So we have to keep investing in research and development to develop new vaccines, and we need to have a change in the paradigm in our approach towards vaccination patterns.
Well, one innovative approach could be, of course, improving transparency through digital tools. In the WTO, we have also the WTO e-ping platform to exchange information and notifications, and to have access to timely measures and detailed information on vaccination, for example, which can help to understand again better and trust them. And very quickly, another approach could be regional cooperation, of course, with countries with similar disease situations, jointly engaging and making it easier to accept vaccination broadly. Improving investments, it has been mentioned, for example, in traceability systems. It was also mentioned in the forum. And continued collaboration with WTO, in particular on building capacity, some innovations. Thank you.
C'est difficile de rajouter quelque chose.
It's difficult to add something after you. I would tend to say that, of course, we have to communicate. We have to show what works, success stories. The impact of success stories, of achievements, on production, on animal production, for instance, on public health also. Let's think about rabies, for instance. You have to show the evidence, the proof of the impact. I think that's a very efficient approach. And then you can add all the tools that you've mentioned. I'm not very familiar with these tools. I'm trying to, though. But I think that we should also pay attention not to sort of over-promote vaccination, because you have to remember that it is a tool, it is a useful tool in some cases, but it's not a magic wand. So we have to be very clear about that. It's not a magic formula. It's very important to say this when we communicate. And maybe we should also boost research, because what we are lacking of are quickly available vaccines. How can we switch from a strain as fast as possible into a fast vaccine production? I know there's been a lot of progress in this particular area, and I'm thinking about all the things that we can do to improve this innovation-wise. Thank you very much. As for something I've been thinking of, which is a future technology which is called gene editing. Gene editing from specific diseases. This innovation is available and deserves to be further developed.
So many tools in the toolbox for us to learn how to use effectively. Right, we're going to have our final summing up statements. 2 minutes per speaker. And this is the question. What should WOAH and our stakeholders do to facilitate the implementation of international standards on vaccine and vaccination to ensure safe international trade and promote sustainable disease control programs? Go, we'll go down the line.
I will just repeat what I have said. We need members to continue working, to continue providing comments to the standard, combining the reality in your countries and the science, and also providing or suggesting experts to WOAH for participating in the other groups. Just that. And also when you come here, we adopt new standards, but do apply those standards. If not, the process becomes useless. Thank you.
I will perhaps repeat a few points also. Well, improve transparency and communication. We have discussed that to help trading partners understand better and trust vaccination and avoid unnecessary barriers to trade. Invest in capacity building programs to promote the use of international standards, of course. And for developing and least developed countries, effective participation in the development of standards, as it has already mentioned by Gaston several times. And this is something also that the SPS agreement encourages members to participate in the development of standards, to make them applicable and inclusive. And perhaps to mention that the WOAH Observatory can be a valuable tool, also another digital tool, has a role by tracking how countries adopt international standards, also using SPS notifications as a key indicator. I have already mentioned coordination, domestic coordination, international coordination, but perhaps focusing more on the collaboration, WTO, WOAH, through the SPS committee, information sharing, again, joint capacity building, and to help address the challenges governments face in aligning their measures with WOAH standards on vaccination. And more broadly, I think this is important also to note, because we're only talking about the SPS agreement, more broadly, collaborating and making use of the tools available in other relevant WTO agreements, such as the agreement on trade-related aspects of intellectual property rights, the agreement on technical barriers to trade, the agreement on trade facilitation, which covers topics such as vaccine access, IP rights, innovation, technology transfer, animal welfare, quality or safety matters. Thank you. I will stop with this.
I would like to say that I think
Je pense que l'OMSA et ses parties prenantes, je dirais qu'elles sont sur le bon chemin puisqu'ils communiquent très bien les uns et les autres. Ils œuvrent à partir de fondements qui sont axés sur la science, basés sur la science. Ce sont les principes, les bases. Que faire pour la prochaine génération? Eh bien, je pense que c'est le chemin à poursuivre. Je pense qu'il faudrait aussi... Vous savez, aujourd'hui, j'ai lu par exemple récemment une étude qui disait qu'au XVe siècle, une personne disposait autant d'informations dans sa vie, que le même nombre que le nombre d'informations qu'on reçoit nous en une journée. Et malheureusement, beaucoup de ces informations sont négatives, surtout quand on parle de vaccination et de contrôle de la maladie. C'est pas toujours négatif. On parle toujours de foyers majeurs, mais parfois il faut reconnaître le risque et les aspects négatifs. Et aussi les présenter d'une façon positive pour donner espoir aux personnes, pour montrer qu'on améliore le monde qui ne cesse de s'améliorer. C'est tout ce qu'on leur demande. C'est ce que l'on veut dans ce monde. Et regardez comment ce monde s'orchestre et le laisser en meilleur état que quand vous l'avez trouvé. Si on s'engage à tous faire ça, je pense qu'on améliore déjà pas mal de choses.
Is ready to do whatever you want, but one is to be support. So I know I'm joking, but yes, we have heard a lot of very interesting proposals. I wanted maybe to go in a slightly different direction and to highlight the role of WOAH at regional and sub-regional level. I really want to really acknowledge the work of my colleagues in regional and sub-regional level, and I will speak about it later this afternoon. I had a change in the chart of the organization, and I really think that we need to empower our regional and sub-regional representatives in order that they can better assist members to implement standards, to understand standards, maybe to discuss, to help neighbors working together or understanding better each other, or also to help the dialogue between countries when it's needed, because in some places it is not needed at all. But really, I think act at a local level, it will be also very important, I think.
What a great discussion. So we have the science, we have the standards, we have a way to update our standards based on science. We have a way to adopt those standards once they've been updated. We have platforms, formal and informal ways to share information. We have regional structures, and we have a call to action for all of us to use these tools and implement what we adopt in the general session. And with that, I'm going to pass it back to Marichal. Thank you. Oh no, Subati, sorry.
Thank you very much again. We would like to really, it's not yet the end, this is session 5, but I think it's been extremely a good session that has kind of helped us start summarizing what has been discussed over the 5 sessions up to now. And honored to have the DJ also being part of, I think what the DJ has said is summing up also what we feel is the way forward. But there's still a session that will be, session 6 will be fully based on the feedback, the questions from your side. But as we're finishing now the different interventions that have taken place, we feel that it's been quite clear that vaccines are very critical key tools, and they can further be used to address a number of key challenges, such as the AMR and the emerging disease threats and so on. We have discussed challenges to increase vaccine adoption and vaccination, and have also identified many other opportunities. I think the opportunities are extremely critical, and they've come out quite clear throughout these sessions. And in conclusion, I think we need to improve efficiency and effectiveness of vaccination. We need vaccines that are fit for purpose. That has come quite clear that it's a critical element. We need that they are delivered at the right time, the right place, and that they are given in the most efficient and acceptable way. We heard about different strategy like integration or combination vaccines, which could improve effectiveness of delivery. We heard a lot about communication. I think that has been quite an important element. I think as veterinarian, we should more and more start integrating social sciences. It's been said by many groups, so that communication is a critical element for the success of vaccination, and that we should have an impactful contribution to disease control through vaccination. Vaccine, as we heard, is not the magic tool. It's part of disease control tool, so we should consider it as a critical element. So now we need to start thinking, what can we do better as WOAH or as delegates and as individuals to implement vaccination as an important tool. So we need to start thinking of translating this into actions. And with that, I really would like to thank, I've maybe didn't say it much at the beginning, for the whole technical item to be put together. The Secretariat has been fantastic. They've done an extremely great job to facilitate our work. And also to thank all the different panelists that agreed to be part of this process. And we hope that is not the end. But like I said, session 6 will give us an opportunity to get feedback from your side. But in the meantime, really, I would like to thank panel 5 for your wonderful contribution, and thank you. The facilitator, sorry, I forgot. The facilitator has been wonderful.
It was. What a wonderful way to start the day. I hope you enjoyed us as much as we did in the backstage. Thank you, Dr. Dungu, for summarizing and for such a clear, insightful summary. You have all really helped us to see how vaccination decisions goes far beyond the scientific outcomes, influencing national trade, shaping by public perception, and dependent to societal support. But before that, Dan and I wanted to mention you have all done magnificently. But we were surprised about one of the panelists, one that is in his phone right now, I hope following Instagram, the World Organization of Animal Health on Instagram. And we wanted to congratulate you, Felix, because you have a clear understanding of WOAH with the guidelines, with our standards, and you bring us this vision of the future, and we really appreciate your contribution here today. Congratulations. I think he deserves another round of applause.
And this conversation has brought us one step closer to the vision that we want to see for animal health, one where vaccination strategies are better integrated into national and international frameworks, where trade considerations are addressed with greater clarity, where supportive mechanisms are there to help facilitate mutual understanding and cooperation among partners.
And perhaps, most importantly, linking the vision to our WOAH 8 strategic plan by including long-term disease control strategies. This has made the discussion more practical and focus on real actions that we all here can implement. And this might be my favorite sentence of the whole script. And WOAH, the World Organization for Animal Health, and as we heard, is here to translate science into action.
Exactly, Mariana. And this brings us to our last session of this year's forum. I can't believe we've got here already. It's went in too quickly. And this will serve as a comprehensive wrap-up.
And the time has arrived for our panelists to address the questions and the comments that you have been submitting in the past 2 days already, and maybe also this morning. So regarding the discussion on vaccination, we will address the comments that you have been sending in our upcoming session, session number 6.
Thanks, Mariana. And to guide us through this closing discussion, I have the pleasure to welcome to the podium Dr. Christine Middlemiss, Chief Veterinary Officer and WOAH Delegate for the United Kingdom. And Dr. Middlemiss is also a member of the WOAH Council, and she gets some extra special points from me because she's also Scottish. And she's promised me next year that she's going to wear her kilt on the Sunday of the general session.
Well, I didn't have my kilt this year, so I decided to align with Marianne instead. Thank you very much, guys. You've been doing an absolutely great job taking us through these panel sessions, which I think have been absolutely fantastic in helping us explore the topic of vaccination, something as a council member I've been really passionate that we've had as our technical item. And so now is the opportunity to hear from members of the floor, to have your feedback, your questions. We're going to go through some of the questions that you have been submitting, but we will also take questions for the floor. I'm going to do it on an alternate basis, so have your questions ready. We'll start with one of the submitted ones, and then we'll move on to one of your questions, and vice versa. I'd like to invite to the stage to help answer the questions our colleagues, as we know, Monse, please, our Deputy Director General, Batty and Mary Chell, who have been helping us as excellent rapporteurs through this session. But once we've done the question and answer session, I'm going to hand over to Monse, and we're going to talk about drafting the resolution. So we're looking for support, obviously, from a number of delegates to assist with that. We also, of course, have a number of panel members also sitting along the front here. So be prepared, panel members. Some of the questions may be more appropriate for you to answer, and we'll send them your way. So as I said, I'm going to start with one of the submitted questions. And this is a general question, and I don't know whether Batty or Mary Chell want to pick it up. What mechanism can be put in place to facilitate the sharing of knowledge, technologies and best practices related to vaccination in animals? And I think a mechanism, as we've heard, sometimes we have time to plan vaccination, sometimes it's short notice, it's an emergency. So I'm interested in the mechanisms you think can help us members in those situations.
Thank you. Well, I think through the presentation we've heard of many tools that exist and many approaches that can be used. But there are also platforms that provide a lot of information, be it technological platform or networks that exist. I think a lot of this information can be obtained through this. I can think of a number of networks that are providing best practice examples, like the International Veterinary Vaccinology Network. There's a network called Bactivac, I think. But Star Ideas also has been one of those institutions that has been having a lot of information where people can get a lot of source a lot of information on best practice and information that exists. I don't know whether you want to add something. Yeah.
So perhaps something is that there could be an easy, accessible way or list to know where a number of these support tools are. It's difficult in the heat of the moment to remember all the different organisations.
Yeah, I think we may share that information, but there are quite a lot of such networks and platforms that are available.
Good. Thank you. So, and now I'm coming to members, colleagues, attendees for any questions you may have. Stage. I can't see hands very well, so I'm hoping colleagues with microphones around the room can. Yes, we have a question here in this row here. Thank you. It would be great if you could introduce yourself, please.
Thank you very much. This is Dr. Sufyan, WOAH Delegates of Bangladesh. So thank you. Last panel discussion very clearly mentioned regarding the vaccination and trade barrier or trading system. So as we are the livestock animal health population people, so we have a tremendous pressure, as our Director General WOAH mentioned, putting pressure on the protein supply of 8 billion people in near future, maybe 10 billion people. So we have a tremendous pressure on animal protein supply. Number two, from the public health perception, public health people, we have many pressure regarding us. For example, WHO Assembly mentioned that around 30% of antimicrobial use reduction in 2030. So there is a climate change also one of the tremendous pressure. So from my side, one question, maybe that the panelists, so do you think, as our director mentioned, the general mentioned that fear of trade barrier or trade makes the public health threatening in near future?
So I think the questions about the trade barriers, yes, and how we, reflecting on the last session, and the huge amount of pressure that will be on us to consider vaccination, given the changing climate, the environment, the public health, society interest in animal disease. How, and maybe I'll come to you first, Monse, for this, how we really take what we've been discussing in the last session into action in terms of trade barriers.
Well, I think in general, first we need to really gather the data. We need to know what are the solutions that we have. We all know that we are living in a time where we have different priorities, different pressures, different needs. Climate change is certainly one of them, but in that sense, we also have, even if we have all this, we also have a big tool, and we've been mentioning over the past three days that we have a big toolbox to be able to choose how we can use certain of these tools according to the situation. Like we said, for certain diseases, we might have vaccines. For certain, we don't, but we have other mechanisms. We have biosecurity. We have zoning. We have other mechanisms that can support us. But what I think what we really need to do is, first, these tools, they need to be better communicated. So we're aware of them so that we can use them when we get them. We need to increase, and this is something that has been also repeated consistently, we need to communicate better. And we need to engage the different stakeholders to be able to do so. And when we're talking about trade, whenever we are taking a decision, whether to vaccinate, whether to increase biosecurity, it's really important to have this dialogue with our trade partners. It was mentioned yesterday by a delegate of France very clearly how they really proactively worked to try to avoid these trade concerns before, during, and after they decided on a specific program, whether to vaccinate or not vaccinate.
Yeah, carry on, Mayor.
Thank you. And I would like to add that we talk about the trade and the economic implications, but we also discuss about exactly what you were pointing, the importance that we play in public health, in animal public health and human public health. So we need to have these into consideration, because as veterinarians, as delegates, we need to take into account the welfare of animals and people. And we need to take, that has to be an important component of the decision.
Yeah, I absolutely agree. There's the physical health of people, and then trade, as we know, is part of those impacts. As we heard from some of our African colleagues, trade impacts for them in terms of vaccination are as critical for any of us. So while you're thinking of our next question for the panel, I'll take one that was already submitted. This is for you, Monse. What is WOAH's position in supporting quick release testing to achieve a faster reaction in emergency situations? And how is this addressed in relation to interactions with both regional or national competent authorities and governments?
Well, WOAH certainly supports the need of members to actually grow in their capacity to anticipate, cope, and respond to emergencies. And part of this is planning for emergencies. And indeed, because by doing so, it actually, we can define a country's capacity to, and confidence to tackle these emergencies. So in this sense, of course, we are supportive of countries actually looking on ways of doing and considering quick release testing in their emergency planning, but they need to do that based on science and assurance that when they're doing that, they have enough elements to be able to do the vaccine, to use the vaccine. Otherwise, this needs to be planned ahead. It needs to be considered with their own regulatory authorities. It cannot be something that can be done like this. It really needs to be planned ahead. It needs to be incorporated in their emergency planning. And in that sense, we have a program that we're really trying to encourage and build the capacity of members in their emergency planning. And this is one component that we could develop in the future.
Yeah. So I think you're saying that there's an onus on us as members and member countries to have already thought of a process in which we might need to make quick decisions and think about, while we won't have the absolute evidence, think about the sorts of things that we will need to be considering and who we will go to for those.
Yeah,
and I think it's also, for me, I tend, when a disease outbreak, think about what must I tell WOAH? I don't always think, what must I ask WOAH? And I think that's very helpful.
Yeah. And I think the second part of what is of your question in regards to the regional interaction, I think we've all seen that being able to share experience is very important. Yeah. We are well aware that some countries have already included this consideration of quick release testing in their emergency planning, but discussing this at regional level certainly will help. It's very difficult to communicate during crisis. In WOAH, we always want to be very careful of what to ask when you're in an emergency, because we all know that you're already having to take too many decisions during a crisis. So that's why emphasis on emergency planning is very important. And the emergency planning needs to have this component of communication, particularly within your regions, because it's your neighbors that are going to be more in need of this reassurance of why you're doing or taking certain decisions.
Yes, thank you. I was involved, of course, in UK 2001 foot-mouth outbreak, which felt really terrible at the time. And the big lesson for me was just how important communication is. Communication up to ministers, communication out to public, and communication with farmers. It was a real lesson for me that really it is one of your most effective disease control tools. So now we're going to turn back to our audience and colleagues for any further questions. I can see there's a couple down here, both Denmark and Australia, and maybe some others I've missed.
Okay, thank you very much. I'm the WOAH Delegate of Denmark, and I speak on behalf of the 27 member states of the European Union. The EU commends WOAH for bringing vaccination, this really important tool for the prevention and control of animal diseases, as the technical item for the Animal Health Forum of this general session. We fully support the content and the conclusions of the report of that technical item presented by the rapporteurs, which we congratulate. Vaccination is indeed a powerful tool that can be used alongside with biosecurity as surveillance, as we've also heard in the different sessions up till now, the two crucial cornerstones of any disease prevention and control strategy for animal diseases. However, as vaccination can complement these key tools alone, it cannot replace them. Equally important, there is no one-fits-all solution. The animal diseases we are facing are very diverse, as are the animal production sectors in member countries. This was well demonstrated by this discussion in this forum as well, right from the high-level panel discussions and the first session on vaccination decisions, down to the vaccination equation and in conclusions of the last session. The EU would like to stress again that vaccine adoption is tightly linked with disease-specific prevention and control strategies, which stem from solid cost-benefit analysis. These analyses applied to vaccination must integrate the identification of needs, purposes, and expected impacts, as well as both material and logistical costs. In that respect, the EU highlights the importance of relevant WOAH standards, especially the Chapter 418 of the Terrestrial Code. This chapter states that the success of implementation of vaccination will depend on the quality of veterinary services, the quality of animal health surveillance, and the quality of vaccines. It also recommends, when deciding whether to initiate a vaccination program, considering among others the probability that the disease cannot be rapidly contained by means other than vaccination, the suitability of a vaccination program as an alternative to or an adjunct to other disease control measures. The cost-benefit analysis of the vaccination program, including its impact on trade and public health. Based on these recommendations, the EU has established for many years already a harmonized legal environment, introducing a paradigm shift allowing for a broader use of vaccination against animal diseases. This includes science and risk-based rules for the use of vaccination against certain listed animal diseases. These rules can be adjusted regularly and swiftly to take on board the most recent scientific developments or relevant international standards. They provide EU member states with the directions on how to use vaccination and make them conscious of the consequences of vaccination, including not only costs of vaccination and surveillance related to it, but also the consequences in terms of international trade restrictions, which should be limited to the management of risk of disease spread. We would also like to highlight the crucial importance of the availability of union antigen and vaccine banks against certain high-impact transboundary animal diseases. These banks, fully financed by EU funds, are currently established for diseases such as foot and mouth disease and lumpy skin disease, and have been used to support the fight against these important animal diseases in the EU and its neighborhood. So this was more of a comment than a question, but I thank you again.
Thank you very much for that, Denmark. For highlighting your considerations and what's been really important for you in this discussion. It's most welcome. And I think our next question is, I'll let you introduce yourself, Beth, instead of me doing it.
Thank you, Christine. I'm Beth Cookson, the delegate for Australia, and I will take the question and then go back to you for the next one from the written submissions. We've heard a lot.
Oh, I think they're asking you to stand up, please. It's so we can see you better on the big screen.
Very complicated to organise all of the things off my lap quickly. Sorry for that. We've heard a lot over the last couple of days about the practical considerations around vaccination implementation. And that includes vaccine readiness around implementing a vaccine campaign. It includes considerations of how there might be better integration and combination of vaccination campaigns. and in particular, the recognition that regional coordination can create efficiencies and it can increase transparency. So my question is, what practical steps do you see that we can take to achieve this? And is that a specific outcome from this forum that we can agree as a global community? Thank you.
Excellent question. Thank you, Beth. And I think maybe all the panel members will have a view. You can go first.
Thank you, Beth, for that question. I think I would say the first one, what is the main outcome of where we're heading? You anticipated a little. At the end of this part, we will request some of you to participate in the drafting of a resolution. And as you know, these resolutions, they actually guide a lot of the work that WOAH, with its membership, is going to be moving forward in regards to the recommendations of this panel. The other practical way that I believe it's really important, you as members can put these subjects in your regional commission meetings, either as further technical items, maybe also have a small forum of discussion within the region, discussing the issues that you believe that in the region are important, and sharing your particular experiences and maybe follow up from the resolution. I think that's a very precise way of moving forward. Thank you.
Thank you, Monse. So there'll be the conclusion, of course, the recommendations, but work for us all still in the regional forums. I'd like to have our other colleagues' view on what practically you would like to see us do following this discussion.
Yeah, I think our hope is that this is a start of looking into way to further integrate vaccination. I mean, to improve the way vaccination is integrated and used as a control tool. I think we have already a lot of reference in both the manual and the code referring to specific disease. But I think a better emphasis and looking into area where we identified some possibility of opportunity for improvement, I think will be an ongoing process within WOAH, we hope, so that we can see that as vaccine technology, for example, is improving, how we can quickly integrate technological advances, innovation, and also trade conditions to integrate vaccination into addressing these specifics. So I think if we look into specific disease, there would be a lot of opportunity really for change. Thank you.
Thank you.
And one also specific thing that I think would be really helpful is to have the target product profiles. Because if we have target product profiles that are agreed for a use case, so if I want to control a disease, or if I want to eliminate, or if there's an emergency, if we have already agreed as consensus, and I'm thinking about a wide stakeholders, not only the countries, but also the industry, the farmers. So if we have a consensus on what the vaccine should be, and then it will be easy for us to apply first to the developers to develop the right vaccines that we need, and also will be easy to agree for the implementation because we have the vaccines that we want, we have the vaccines that we need. So I think having consensual TPPs that are publicly available will be a very practical step.
Thank you. So some specifics there, target product profiles, but also that we must make the actions from this session living and contemporary as time progresses. And we all have a role. It's not just about WOAH, it's not just about members, it's about all of us as an animal health community. My next question was a submitted one, and it's a bit more specific, and I'm going to ask it of Batty or Mirachel. What advice could be given to countries on deciding who should compensate for vaccines, the state or industry or farmers?
Well, it's quite a tricky question in the sense that compensation, as far as I'm concerned, is not really on vaccination, but it's more as a way to address a disease problem. So I don't know whether the compensation being referred to here is would be what, for example, was described in France, and I don't know whether. Where is she?
Is there?
Maybe she could give practical situation how it was handled in France, because we heard it yesterday. I think it was quite a good way that it was handled. I don't know whether...
Marie-Christine, would you be able to give us some insights on your situation?
Thank you. You're always the one giving me the tricky questions.
It's
Thank you
because
very
your
much.
name is half similar to mine, I remember it.
Well, actually, in France, we share the costs between the states and the sector. But still, as you can imagine, it's a difficult conversation. I think it's the same for all of you. Who should pay? And also the question is, should the farms which are vaccinated support the cost, or the whole sector benefiting from this policy? And I know in our sector, in France now, poultry sector, it's a difficult discussion that is amongst stakeholders. So for now, the solution that we have in France, I don't know if it's the best one, but it's the one we get. It's to have a state support and also taken by the duck industry, because as a reminder, the vaccination in France is implemented only in ducks. So it's the duck sector and the states paying for the vaccination.
Maybe I could add something. We tend, I understand that we talking essentially to CVOs, we're looking into controlled disease, but you have also vaccination for production diseases. I think usually farmers have no problem because they see the cost benefits of vaccination. And you get also diseases that are in between, which are controlled, but they have a direct impact on productivity. We've seen it with, for example, in countries that are affected with foot and mouth and affecting the dairy sector. It becomes even difficult there because the dairy sector would like to vaccinate, but they have to wait for the government to procure the vaccine and start vaccinating. There you need really a good dialogue, even if the industry can buy the vaccine, but it's controlled under veterinary service, then that could speed up such vaccination process instead of waiting. So I'm sure the CVO from South Africa could give the example of what was experienced with the dairy sector, but that's a very real situation.
So really a joint partnership approach where each brings to the table what they can bring that the others don't have the ability to bring. I think that's a very good point. And one point I wanted to make from my experience both in practice, and I come from a farming family, cost benefit in terms of actually not always money but time saved. Farmers appreciate saving time because they're worrying less about sick animals. Invest the time in the vaccination and then you're freed up. Now I think we have a question upstairs, please, that we're going to take next. I'm afraid I can't see you very well because of the lights. There we are.
Didier Delmotte,
Didier Delmotte. I'm the chairperson for the Animal Health European Federation, and I'd like to say a few words about mandatory vaccination that we organized in Belgium on serotype 3 and 8 blue tongue disease. So even if there was a slight problem of availability for serotype 8, vaccination was a big success, and it had an undeniable impact on the spread of the disease. And it's also an opportunity for public authorities, health authorities and farmers to work together. And for trade, there is no disparity because it's the entire herds that were vaccinated. And even if this situation is quite non-typical within Europe, it's important to mention it because if you have one farmer that decides to vaccinate alone, he will have great difficulties in obtaining the vaccine, so it's almost impossible. And then what would be the impact of one farm being vaccinated against a disease? It would be nil. So when you have a disease like blue tongue, we need to encourage the authorities to really start acting and not let the industry alone.
Absolutely, we need to think about the protection of our whole of our susceptible population to get to eradication of disease. Do you have anyone want to add any comments? No, we're good. So one final and slightly different question that was submitted in different ways, but it comes to one question from by colleagues from the Democratic Republic of Congo, Norway and Somalia. And I might pick on one or two panel members also to help with this. What could WOAH do to facilitate research for veterinary vaccines around the world? Montse, I'll come to you first, and then maybe my colleague Don King from the UK, as involved in research, might want to answer too. I'll repeat the question, Don, when it comes to it. Montse.
Thank you, Christine. I think it's a really, really relevant question, and I'm very happy that it was posed because we have a very strategic partnership with the Staridas and the International Research Consortium. This consortium unites over 35 major animal health research funders with the potential to mobilize over $2.5 billion on research investment. And this collaboration can certainly significantly boost funding and resources for veterinary vaccine research. So currently we are coordinating efforts by focusing on accelerating the development of vaccines for major infectious diseases of livestock and zoonotic threats. And this involves a pooling of global knowledge, capacity, and funding to support the implementation of global health strategies. And a very nice example, we just had it 2 months ago in headquarters, where we, under the WOAH Animal Health, Aquatic Animal Health Strategy and Staridas, we carried out a global consultation to identify the highest priority areas for research that could provide lasting benefits in the management of aquatic animal diseases, particularly those that will impact international standards. So this is, I think in this way, WOAH can really leverage this collaboration that we have with the Staridas to actually influence how research in regards to vaccination can go forward. Thank you.
Thank you, Montse. And Don, the same question. Your views on what WOAH could do to facilitate research for veterinary vaccines around the world?
Thank you. Thank you, Christine, for the question. And I mean, I'm not going to give a comprehensive answer in such a short time, but perhaps to echo Montse's point, I think it's important, I think, that researchers in the academic space have a clear message from organizations such as WOAH about the priorities for their research. So identifying key priority diseases where further research is required is obviously a key aspect, and perhaps also identifying diseases where no vaccines are available and where there is a need to do research to identify vaccines is a key activity. I mean, an area that perhaps is often a big juncture between the work that's done within the universities and the academic institutions and the delivery of practical vaccines. You have what's this wide concept called the Valley of Death, where you have a lot of researchers that are often generating really good ideas and really good proof of concepts, and quite often those technologies, those insights are not taken forward into the commercial area. And I think that's an area that, again, through engagements with WOAH and through the members, I think it's key to get the latest research taken up by the commercial sector in a most efficient way to develop the tools that are needed.
Yeah. Maybe I can, well, it's not going to be me, actually. I can link this also to AMR. WOAH has been developing a disease list to where these specific diseases, vaccines could actually benefit the reduction of vaccines. But maybe I can ask the support of Javier, that he's leading this part. Yes. So maybe he can give you an idea of where we're at with this disease list as priorities exactly for research, because we have some vaccines and others where we need to have that research. Go ahead, Javier.
Yes, thank you. Yes, thank you. So WOAH developed a couple of lists on priority diseases for which vaccination can reduce antimicrobial use. They were developed in 2015 and 2018 for all animal species. And the prioritization of this list was made based on the research and development needs. So if you remember, it was mentioned here that last year in September 2024, there was a United Nations political declaration signed by your heads of state and adopted by all the members, where all the members committed to ensure that by 2030, vaccination strategies against some of these priority diseases should be in place in the country so that the reduction of antimicrobial use is going down. So we are going to update those lists from the scientific perspective, and we are also going to prioritize within those lists the top 5 diseases for which we see that there is an achievable target that can be accomplished by 2030. And that we are going to do that in consultation with the pharmaceutical industry, with the producers, with the farmers, with all the stakeholders, because we know that producing a document and leaving it in a shelf is not enough for make things happening. And last but not least, we are also going to support you and to accompany you in asking for investment in the strengthening animal health systems and veterinary services. I recall again the report that was mentioned in one panel about the World Bank, where they were saying that putting pandemic behind was meaning investing in animal health systems. I'm just going to give you one figure. In the AMR space, the amount of money invested in research and development for vaccines in animals given by philanthropic institutions or public institutions represents only 7 cents out of $10. And I repeat, only 7 cents out of $10. So we need to change that trend, because with that amount of investment, we cannot do much. So we need to advocate for higher investments in animal health, and we are going to accompany you on that task. Thank you.
Thank you very much, Javier. So that rounds up our question and answer session at the end of this technical item. Oh, you have, sorry.
Sorry, there was a question I promised the CV of South Africa that will answer today. Yes. I don't know whether, I'm sorry.
Where is he? Ah, no.
Yeah, behind the camera. Sorry.
Oh, sorry, there's no. Ah.
No.
He's behind the camera, I think. Dr. Modisane.
So many hands waving, I'm a bit confused. Ah, there's a question here. Let me say. Sorry.
Sorry.
Oh, sorry. There's so many hands waving and the bright lights in my face, it's not quite easy to see what's happening.
Thank you very much. I'm called Dr. Anna Rose Ademun from Uganda, Civio, Uganda. Mine is that it's very interesting now that we are looking at expanding vaccine production to other nations and maybe the other continents. It's a very good idea. So my proposal is WOAH can help by expanding the twinning programs, because a twinning program is a program where laboratory can work together with the other and such that they can grow. And so the vaccine processes can be grown through the twinning program and ensuring that the intent is vaccine production at the final analysis of the twinning program. So that should be done intentionally, and that should help to expand the activities. Okay. Thank you.
Thank you for that comment, and strong support of the twinning programs. I've lost sight of the microphone. Hugo. Does our South African colleague have
Gracias. Espero que se ponga.
Thank you very much. And I'll give you a minute to put your headsets on because I'll speak Spanish. So this was an excellent debate, excellent quality of debate. However, I'd like to make some comments. I totally agree with the guidelines for the use of vaccines, and we agree that and say that vaccines are a priority tool to control diseases. But I'd like to say it would have been very useful if experts from all regions had been present on the panel so that we could have heard the opinion from all continents and so that we have a more exhaustive vision, because realities are quite different from one region to another in the world. In some countries the problems are quite similar, but in others they're quite different. And in South America, well, that's a region in which we have huge production of animal protein. We have lots of cattle or sheep farms and goat farms, and we are 70% free from FMD and without vaccination, and 25% are free with vaccination. But why do we want to be FMD free without vaccination? Well, that takes me to the trade issues, because it would prevent us from exporting to certain countries which are more developed countries, because they would impose measures on us, and at the end of the day that has an impact on the budget of exporting countries. So that's a difficult issue. But once you can sell on export markets, the prices are not the same. And I hear everybody in this room defending vaccination. So I would have liked hearing people talking about the benefits of not vaccinating, especially in the field of trade, because everything really depends on the part of the world where you live, and many regions do depend on animal production. And what do farmers do? I mean, they produce, they want to make money, and the use of vaccines limits their ability to export their production. So in the resolution, I'd like to see a reference to transparency in enforcing the standards. We're 183 countries represented here. We approve standards which then are not implemented or are not implemented fully. So it would be good encouraging transparency there, especially when we talk about international trade.
Your comment, and we're on very shortly after the one final question up here to talking about the resolution and how we're going to draft it. So I think that's my colleague from South Africa going to make the comment now. Thank you.
Thank you very much. Thanks, Dr. Dungu, for remembering the question posted yesterday. Really, the question related to one of the questions that came from one of the panelists, to vaccinate or not to vaccinate. But for the highly pathogenic avian influenza, thanks to France for sharing their experiences with us. But the trade-related concerns that are arising from the fact that a country has vaccinated for a disease like a highly pathogenic avian influenza, how do we as a global community propose that we handle those concerns? That relates to the fact that we understand that highly pathogenic avian influenza has really been devastating our poultry productions. And to a large extent, it is also affecting our marine beds and marine life to a very large extent and creating a lot of devastation. Thank you.
Thank you for that. Who would like to pick it up briefly before we move on?
I would refer back to the code chapter, and I think in the code chapter there are the conditions that are encourage members to implement. And I think in general, it goes back to what has been discussed before. We have standards that are, and you adopt them as delegates. We just need to be a little bit more consistent on whether in the implementation of the standards, if we agree that we can go in the implementation of standards, taking a risk-based, taking evidence, then we really need to be coherent when we're trading based on these standards. So part of it is the communication that needs to be done. I think the chapter establishes well when to use vaccination and how you can keep trading with the vaccination when you need to really give the evidence that there is no circulation of avian influenza. And that needs to be considered by the countries. If we make the commitment or if we agree in a specific standard, we need to make the commitment to implement them. Thank you.
Thank you. And as members, we implement both as an exporting or importing country and perspective. Our WTO colleague is going to have the last comment because we need to move on. I know people have further questions, but we'll all be around for some time after.
Thank you so much, and I hope it's not the last word, but I just wanted to react to the comment from the CVO from South Africa, and also in relation to my participation in the last panel, because I think due to the lack of time, we couldn't enter into more specifics on trade concerns in the WTO in relation with vaccination. And here I think I want to make a point that actually when we look at vaccination, there have been there are no trade concerns where vaccination is the central concern of the dispute so far. So I have mentioned, yes, generally about a third of STCs relate to animal health. Actually, if we look at vaccination, STCs relate where there has been reference to vaccination. There are about 40 STCs, 6% of STCs, some discussions on vaccination, and mainly to the point discussed by the CVO from Paraguay on FMD regionalization with or without vaccination, and mainly this concern about ensuring that the region is without vaccination, the issue of trust, issue differentiating animals that are vaccinated, not vaccinated, all these issues. The discussions touch a little bit on that. But the key message is actually that you have a platform, the WTO platform, to raise concerns if you have legitimate concerns with, you're using vaccination, you are following WTO standards, they are based on science. Well, you are still restricting my trade. Give me an explanation. And this is a cost-efficient way to discuss concerns, because we have been discussing formal disputes, and actually that's the minority of cases go to the formal dispute. Most of the issues get resolved in the bilateral discussions, of course, perhaps then the trade concerns disputes. And just to a final point, members also report on resolution of trade concerns, and that's on a positive note, just to say that about 60% of trade concerns that are raised in the SPS committee have been reported as resolved or partially resolved. The same for those related with where there has been reference to vaccination, about 60% have been reported as resolved or partially resolved. Just that. Thank you very much.
Thank you very much for that. And thank you also to our panel who were responding to many of the questions, Monse, Batty and Marichelle. Now, Monse, we have to discuss selection of the resolution drafting team, please. I'm going to hand over to you.
Thank you, Christine. And I would like to make the invitation. We were thinking of making a resolution drafting team that will include, of course, our rapporteurs, Batty and Marichelle. Our Animal Health Forum Secretariat, it will be Andres, Rachel, that I also want to take advantage to really thank you. They have been instrumental in the working of this forum. They are behind the scenes, but they have been really supportive to our rapporteurs, to me, and to all the panelists all through for the past 8 months. So they have been also the brains of this operation. And we will have also Gregorio and Javier that have always been guiding the whole thing to be able to have this successful forum. And then we were thinking we would like to ask members of the Council and the Regional Commission if you agree. We would really like to have the UK and Japan and Bahrain as members of both the Council and the Regional Commissions. And then as delegates, we thinking of the different interventions that have been done in the panel, I would like to invite France, Denmark, Australia, Singapore, Bangladesh, Chile, Paraguay, the Democratic Republic of Congo, Kenya, and South Africa. And from the international organizations that were not represented on the panel, but they were also very active in the questions, I would like to invite the International Poultry Council and Health for Animals. So if you can please go with Andres and Rachel, just to see on the logistics. And with that, we will be meeting in room 162 right after this session, so we can start with the drafting. And thank you for that.
Thank you, Monsi. So if all those members can meet as requested just as we finish this session. So this draws to the end our technical item for this general session. I think it's been absolutely fantastic what we've heard, the engagement, and obviously there is still a lot to do. So again, thank you to the panel members, both these panel members and other panel members, and everybody for their contributions. Thank you.
And just a final thank you also to the Secretariat.
Yes.
Thank you so much. And our translators, of course.
And I'll hand back now to our fabulous moderators.
So thank you to all who made the forum possible. And as you can see, this conversation goes far beyond words. This technical item, now transformed into a forum, has one purpose: to set real change in action, to make vaccines a core component of disease control and not just a concept.
Thank you, Dan. We are grateful for everyone who participated in this forum, and thank you, Montserrat, for mentioning all the work of the Secretariat behind this technical item and Animal Health Forum.
And now it's time to make history, as Dr. Arroyo said, by drafting a resolution that will put into action our discussions of the last couple of days to fulfill our mission.
Improve animal health globally. And remember that it's not over yet. This afternoon, we continue with the first plenary session at 2 o'clock, right here in the plenary room de Lavoisier. But then you have something regarding this session?
Yes, just a quick reminder about the arrangements for the plenary session. At 2 p.m., we will begin the first plenary session here in this main room, and access to the ground floor will be only reserved for WOAH member delegations. Each WOAH member has been allocated 2 seats arranged in French alphabetical order, and these seats can be used by the delegate or the alternate delegate, or by one of them accompanied by a member of their delegation. And please note that access to the ground floor by the WOAH member delegations is only possible if the delegate or the alternate delegate is present in the room. Thank you for your understanding and cooperation.
Before leaving, when we will pass the plenary session number 1, we will be followed by the AMR and Wildlife Working Group. And for closing the day, we will have an inspiring panel with the 5 WOAH regional showcasing how building networks leads to stronger collaboration. And please, as you leave the room, don't forget to leave your headset in the tables that are waiting for you just outside this plenary room. Por favor, no se olviden de devolver sus cascos.
Don't forget to return here.
Que los esperan justo afuera. Et s'il vous plaît, n'oubliez pas de les...
Please do not forget to return your headsets at the table available.
Joining us online, thank you to those of you in the room. Please go do enjoy the kiosks and the side events, the first of which is starting in a couple of minutes at 11:15. Let's keep the momentum going. Thank you and see you soon.
Thank you.
et c'est bonjour. 1, 2, 1, 2. 1, 2. Bonjour, bonjour.
Good morning, dear colleagues. Welcome to our general session again. And we will have now our first plenary session, but I'm still waiting for more delegates to have quorum in the room, and we are still missing 10. So 5 minutes more, okay? Sorry for that. So good afternoon again. Now we can start. So welcome you all to our, thank you Monse. Thank you all for attending our first plenary session. And before I proceed, I would really like to acknowledge the high level of engagement that you as delegates and as you as colleagues took into our Animal Health Forum related with veterinary vaccines and vaccinations. It was really exciting, and it was, I'm very proud of this General Assembly, because it was a very, very good forum that we testify. And so the quality of the interventions, the diversity of perspectives shared, and the constructive spirit in which the discussions took place clearly reflects our shared commitment to improve global animal health. So sincerely thank to all of you, and for your always active contributions, and of course to all the colleagues that prepared this forum for us. Thank you so much. So let's start for the agenda. And I will start now. The first item is the provisional program for this 92nd General Session. We have the provisional program, you all received it. It was reviewed and validated by the Council in March. And my first question to you is if you have any comments. We didn't receive any comments until now, but do you have any comments on this provisional program? So I can't see any. There are no objections, so I confirm that the program is adopted by the Assembly. I have a comment in there? Yes? Sorry, because the lights, it's difficult to see. Colombia, go ahead.
Thank you, Mrs. Chair. On behalf of the countries from the Americas, we want to congratulate WOAH for the efforts in sharing information for the vaccination strategy in the field of avian influenza. Can everybody hear me? Okay, let me stand up. So, given the consequences of highly pathogenic avian influenza, we recognize that more measures need to be taken. The epidemiological situation is quite concerning, and the circulation of this highly pathogenic virus, which is strain 12334B, in birds, and its pathogenicity in other species, and the fact that it can be spread from birds to mammals, raises even greater concerns. In Latin America, we have open systems, and we have limited compensation funds. So this generated vulnerabilities, which are a threat for the industry, the poultry industry, but this is also a threat for food safety for more than 650 million people who depend on chicken meat and eggs as main source of protein. A prolonged disruption in the production of poultry would have an impact on the availability of food. And we would like WOAH to make sure that vaccination is regarded as a management tool. And for many countries, response strategies need to evolve in order to include robust vaccination policies that can guarantee food safety. WOAH can support the use of this tool by drafting guidelines towards a vaccination strategy that would allow for safe trade. We also need WOAH support in order to support countries so that they can develop solutions and develop integrated responses. Thank you. Thank you very much to Colombia. And I believe that this comment won't prevent the adoption of the program.
I'll move on to the next item on the agenda, and it will be the nomination of the Subcommission for the Agenda and the Credentials Committee. So, dear delegates, I would like to inform you that the following delegates were nominated by the Council to serve during this 92nd General Session. So we will have for the Subcommission for the Agenda, Dr. Fajer Al-Saloon, delegate for Bahrain, and she also served this last year. And Dr. Mary Van Andel, delegate of New Zealand. Thank you so much. And for the Credentials Committee, we will have Dr. Wilmer Juarez, who also served on the committee in 2024, and Dr. Maza Okita. Thank you so much. Additionally, both members of the Credentials Committee will also serve as auditors of the Council and as scrutineers for the elections. So if there are no objections, I confirm that the nominations are adopted. Clear. Okay. Let's proceed now with the next item on our agenda. And I have the honor to invite our Director General, Dr. Emmanuelle Soubeyrand, to present a report on the organization's activities in 2024 in the light of the 7th Strategic Plan, as well as an update on the ongoing development of the 8th Strategic Plan. It's my pleasure to give you the floor.
Thank you very much, dear Susanna, dear President. So, dear participants, the presentation will be divided in two parts. In the first part, I will share key highlights for 2024, and in the second part, I will provide an update on the ongoing work to prepare the 8th Strategic Plan. Before we begin the presentation of WOAH's activities in 2024, I would like to warmly thank those who contributed to the accomplishment of 2024. The members of the Council and the bureaus of the regional commissions, the experts of the specialist commissions, working group, ad hoc groups, and our reference centers. And my sincere thanks also goes to all our financial partners for their continued support. And of course, to WOAH's dedicated staff across offices, both at headquarters and in regional and sub-regional offices. So let's have a look at an overview of the main activities conducted in 2024. I will first illustrate how 2024 has been a year of transition, then present key figures of our core business, and finally present some key accomplishments through the lens of the 7th Strategic Plan to demonstrate how our actions align with our strategic objectives. The full activity report is, you know, available in the administrative documents under the reference 92 General Session Admin 02. I encourage you, of course, to consult it for a more detailed overview of the organization work. 2024 has been a particularly significant year for the organization and a year of transition. As you all know, we celebrated WOAH's century. This was a unique opportunity to reflect on the major milestones and achievements of our journey. WOAH has come a long way, its mandate has evolved, its visibility on the international stage has grown considerably, and so has the recognition of the important role of the animal health sector. A comprehensive campaign for the century was launched with dedicated events, publications and communications highlighting WOAH's evolution since its creation, from 28 members to 183, for example, and it also significantly boosted our visibility, and our digital media share of voice increased by 262%. It was a year of transition marked by a year of leadership, and I want to sincerely thank you for the trust you have placed in me since my election. Today, I will report both on activities initiated under the leadership of Monique Eloi, my predecessor, as well as those undertaken since I began my mandate 9 months ago, the 1st of August. A new president,
of the World Assembly, Dr. Susana Pombo, was elected, and some new council members were also elected in 2024, and we have already started a fruitful collaboration, and I really want to thank them for their support to me and to the organization. And also new members of the specialist commissions were appointed, and the new commission were begin their work very actively. At the end of 2024, we laid the foundations of 2 strategic projects in the coming years. The launch of a review of WOAH's institutional, technical and financial governance, and to this end a committee of 16 members appointed by the regional commissions will work for 3 years to make proposals to the World Assembly. François will present you, and the president of the Governance Review Committee will present you the work done so far. And preparation, and the second important strategic project is the preparation of the 8th strategic plan to be drawn up collectively in 2025 for adoption in May 2026. Answering maybe a question that that was already asked to me during lunchtime in a side event. Of course, these 2 major strategic projects work together and will not be driven in silos. And last but not least, I also decided to revise the organizational structure of WOAH to improve institutional efficiency and ensure greater regional inclusiveness, which is a key consideration of the next strategic plan. So a few words on the new organizational chart. Maybe it's not very easy to read, but the organization chart has been revised to better reflect the strategic direction and priorities introduced during my campaign, to give greater preeminence to WOAH's core technical missions, to remedy to the imbalance between the directorates and better integrate the regional and sub-regional representation, which were not in the chart before. It was only the chart of the headquarters. So as you can see, there is a new directorate for global framework, coordination and capacity building has been created to better support our efficiency in the development implementation of global initiatives and standards and for capacity building. Regional offices now appear on the chart. It is not just a symbolic shift, it really reflects my commitment to ensuring that no region is left behind and that our organization become more agile in addressing regional specificities. This new structure will take effect on the 1st of August because we needed to make some recruitments. And I am pleased to announce the recent arrival of Mrs. Marie Alison here. I can our new Director of Administration, and the upcoming, on the 1st of July, arrival of Dr. Baba Soumare, who will take the position of the DDG on Global Framework and Capacity Building. While 2024 brought changes, WOAH and WOAH staff has remained fully committed to delivering on its core mandate. So you have a few figures here, but we continue to strengthen the transparency of the global animal health situation, and I want to thank WOAH's team for that, reviewing and publishing over 500 immediate notifications, nearly 5,000 follow-up reports, and we analyzed around 200, it's always difficult numbers, 250,000 news alerts through epidemic intelligence, because as you know, we are chasing the news and the information on the website. WOAH also granted new official disease status, and thanks to the departments, to countries, and of course the specialist commissions, countries or zones, reconfirm hundreds of others, and published self-declarations, which has increase multiplié par 2, both of which are essential tools to facilitate safe trade and market access. 72 standards were adopted, and we issued 8 new guidelines. We'll come back to some of these in more detail later in the session. We ensure the dissemination of scientific knowledge through publication, technical documents, newsletters that reach diverse audiences around the world. And we continue to support our members through capacity building initiatives, including PVS mission, trainings, as well as through the financing of targeted projects. Of course, it is not possible to present them all today, but you can have good ideas because we try to, by a lot of communication, which was done too during this year, to value them in our different social network or on the website. But let us now have a closer look at the specific achievements linked to the 7th strategic plan, which is running until 2026. As you know, the 7th strategic plan is built around 5 strategic objectives: scientific expertise, data governance, responding to member needs, collaboration with partners, efficiency, and agility. For each of these objectives, I will present a selection of achievements for 2024 that illustrate how we are translating our strategic vision into measurable impact. Let's begin by scientific expertise. Our first strategic, in 2024, we placed a strong emphasis on structuring, mobilizing, and expanding access to the latest science to maximize the credibility and the impact of our work. This is especially critical in the current context of infodemic, where misinformation and disinformation, we spoke about that this morning, undermine trust in key science-based solutions. It's not the only one, but we spoke so much about it that I cannot not think about vaccines. So we began by formalizing WOAH's science system, setting a framework that clarifies how our network of experts supports scientific decision-making and standard setting. The science system also informs the revision of our basic texts. The GRC discussed about that early this week, in particular regarding technical governance. In parallel, we continue to generate and share key scientific knowledge and guidance. We launch with our partner FAO our global strategy for high pathogenicity avian influenza in the framework of the GFTAD. The strategy promotes enhanced coordination across sectors and offers practical tools to reduce infection risk and build resilient poultry systems. We released a scientific and technical review of the global burden of animal diseases, providing essential data to guide prioritization and investment in animal disease management. We also issued practical guidelines, and you can see here 2 examples: new diagnostic protocol for African swine fever, and also guidance on addressing disease risks in wildlife trade. There was a side event on this issue during lunch, which is a growing concern. Finally, on the ground, we completed the EBO-Sursi project in Africa after 7 years of important contribution to zoonotic disease surveillance, and with a particular focus on hemorrhagic fever such as Rift Valley fever and Crimée-Congo hemorrhagic fever. 7 years, and after 7 years and more than 60 peer-reviewed publications issued from this project. This successful project, funded by the EU, has laid the groundwork for Zoo-Sursi, a broader initiative to strengthen wildlife health surveillance across more countries, from 10 to 17 and more diseases. And I thank again the European Commission for the fund of this very big project. Through these efforts, we reinforce WOAH's credibility as a global authority on animal health and as a trusted source of scientific expertise. And we also ensure that our actions are grounded in robust evidence. On strategic objective 2, data governance, in 2024, we significantly strengthened data governance as part of our digital transformation. These efforts are crucial to make data not only more accessible, but also more useful for the international community. We laid an important foundation for integrated data management with the launch of a disease master data. It is important if we want to have interoperability between devices that we speak the same language. And so we have this work on disease master data and the completion of a proof of concept for a data lake. And this project will improve how the work with animal health data and ensure that different data systems speak to one another. We also provide access to new platforms to improve how data is used and shared. And I want to speak here about the PVS information system, which offers access to the wealth of information gathered through PVS activities. The new standard navigation tool that has been launched to be able to very easily navigate in the standards. It is not a PDF anymore. Updates to WISE strengthen our ability to collect and share timely, reliable animal health data, and our commitment to increase transparency reached a new level. We made our data more accessible through interactive dashboard for members and partners, and we are proud to note that 16 PVS indicators were included in the Pandemic Fund Result Framework, reinforcing the relevance of our data system to global preparedness efforts. These developments reflect our ambition to make animal health data not just more available, but more actionable. I can tell you there is still a lot of work to do in this matter, but that's what we did in 2024. Third strategic objective, responding to members' needs. In 2024, we strive to listening more closely to these needs, to reinforce veterinary capacity, and we scale up our support in emerging preparedness and response. So, in this regard, collaboration is essential. So, for several years, we have strived to accompany our members in the establishment of public-private partnership. You see here a workshop on public-private partnership on this photo. And as we convinced of their potential to advance animal health sustainably. And this dynamic has continued with the launch of a new e-learning module designed to help members engage more effectively in public partnership, complemented by tailored methodological support. We also convened the Africa Public-Private Partnership Forum in Nairobi, bringing together stakeholders to foster regional cooperation. In the field of antimicrobial resistance, we scaled up our assistance to members. We held our first workshops to help countries report antimicrobial use at the national level and completed 5 e-learning modules promoting responsible antimicrobial use. This is another step forward in promoting antimicrobial stewardship in the animal health sector and to contribute to One Health endeavors. You will have a presentation on results that we have, but I'm happy to say that more and more members are reporting the antibiotic use. I think it is very important because the more you report to us, the more we are able to tell to the human sectors that the veterinary sectors is doing a lot of efforts and that indeed the use of antibiotic is reducing and is better used. So I really urge you to use this database. Speaking about One Health capacity building, we made progress with the launch of the One Health Learning Initiative in collaboration with FAO and WHO, and this program is designed to strengthen multi-sectorial coordination. It is, as international organization, we always say to you, you need to work together. But I think that we also need to work together. That's what we do, but it was a next step that instead of having each of us our training program on One Health, it was good to be able to work together, at least share our different training program. So it is an ongoing process, and I am confident in our colleague from FAO who now took the chair for the quadripartite that they will continue this work. Also, to help members respond more effectively to crises, we advanced our incident management system and developed guidelines to combat disinformation and misinformation during emergencies in partnership with Interpol. And I see that I forgot to say that the guidelines that we'll develop on trade, on risk linked to trade of wildlife animals, I forgot to tell you, and it's not that it was done in partnership with CITES. Coming back to my SO3, so we developed incident management system, guidelines to combat disinformation and misinformation during emergencies in partnership with Interpol. Through this initiative, we are not only responding to members' current needs, we are also helping them anticipate and address future challenges with the right tools, training, and partnership opportunities. The fourth objective is about collaboration, because in 2024, we intensified our efforts to strengthen our network of nearly 80 partners. We reinforced our advocacy efforts to further elevate the voice of animal health on the international stage. We actively engage in major international fora and negotiations, including the UN General Assembly and the G20, but also we were present at the COP29, so we try to go everywhere we are invited, and we try to be invited everywhere in order to advocate for animal health. Our advocacy efforts are yielding results. We are proud that the UN Political Declaration on AMR adopted last September and the pandemic agreement adopted a few days ago at the World Health Assembly both explicitly recognize the critical role of animal health. We position ourselves as a central partner of the quadripartite collaboration for One Health, and we served as a chair from April 2024 to March 2025. And this leadership position strengthens our ability to drive coordinated global action at the human-animal plant health environment interface. We also work a lot on GFTAD, beginning to think of how to, it's 20 years now of GFTAD. This year was the 20-year anniversary, and together with our colleagues from FAO, we are now in the process of thinking how to reinforce our commitment and in order to get good results for the fight of the transboundary animal disease like FMD and PPR. So all these efforts reflect our growing influence in the global stage and our continued dedication to building strong strategic partnerships that support our members and ensure that animal health remains a pillar of global health security. Last strategic objective, efficiency and agility. In 2024, we made important progress in performance management, in consolidating the governance of WOAH and enhancing the transparency of our processes. So maybe this is things that you don't really see because it is more internal issue, but I can tell you that we consolidate our internal performance framework by identifying objectives that in the private sector you say KPI, we name them OKP, but it is really a clear objective, organizational key accountability and performance indicators, which will be used to report our performance from next year onwards. To increase transparency, we began implementing a comprehensive financial policy framework, also very important and very important for donors. underpinned by internal decisions, user guides, standard operating procedures, and a digitalized financial and budgetary management system, which is called P2P. And it's a lot of change for the colleagues. In parallel, we implemented new recruitment procedures aiming for a more transparent and inclusive approach to human resources. And I think you have seen this recruitment call that we did for different regional or sub-regional representation, and also for our position at the headquarters. Of course, we scale our, not of course, but we also scaled up our internal control and risk monitoring system and implemented 60% of the recommendations from the external audit. And we will continue to prioritize risk management, not sanitary risk management, but risk management for the organization, particularly in expenditure processes as part of our ongoing improvement efforts. Governance, of course, this time was another key area of focus. We established, I said it already, but it is so important that I can say it twice, second time, a governance review committee composed of 16 selected members to support an inclusive and structural review of how our organization is run. And I really want to thank both the Secretariat in charge of this dossier and François and all the 17 members and more, because they are advisors. So I think that in all it's about 30 members that are very actively participating to this work. So this was my presentation on the 2024 activities. I now have a presentation of the 8th strategic plan development. I don't know if you want me to stop here and maybe ask if there is question. And then
yes, I guess
go to the 8th strategic plan, and so I can take a glass of water.
Thank you, Dr. Souberan. I think it's a very good proposal to hear from you now, so floor is open for your comments or your questions, considering the first presentation. Okay, Congo. You have the floor, our esteemed delegate.
Merci.
Thank you very much. Thank you, Mr. Thank you, Dr. Lemba, from the Democratic Republic of Congo. I'm taking the floor to, first of all, thank the Director General for taking the floor, for speaking, and you chose one of our colleagues to be the Deputy Director General. I'm not trying to anticipate whatsoever, but we've talked about it already, and I want everybody to hear it. So otherwise, some may ask us what is going on. So on behalf of more of my colleagues in Africa, we would like to thank you. Thank you for holding on to your promises. We were expecting some white smoke coming out of Paris. So we stayed in permanent touch with our friend François. He's smiling and he knows what. I asked, is the smoke still black? So he said, oh, you have to wait a little. And we waited until the white smoke appeared. So thank you very much. And our colleague who was nominated as Deputy Director General has our full support to make sure this goes forward. And thank you very much for your support. Thank you for everything. I will speak French. I had clearly indicated that I wanted more diversity within the Direction Committee, and I started embarking on this work, and I was previously said by a wonderful moderators and speakers and masters of ceremony are the two young people. There are 70 different nationalities in WOAH, so of course we would never say there's no regional mixity, but we have to admit that the executive committee, the direction management committee, there's still more room for progress, and progress is still needed. And it's important to make sure that all regions are well represented, although it's always been the case for most of them. But so what's been done is done, and we'll pursue this goal and continue this way.
Yes. Okay, delegate from Bangladesh, you have the floor.
Thank you very much. Thank you, Mr. Director General. You specifically mentioned 6 activities that was done during 2024. So special thanks to one special activity in Bangladesh. Regarding Bangladesh, we are now facing as endemic in like the avian HPAI. So in 2024 to 2033 global initiative documents that are obviously very useful, and we already adopted, and Bangladesh adopted new document in light of the global WOAH document. So special thanks for this. Thank you very much.
Merci beaucoup.
Thank you very much.
Document global strategy is very useful. After that, what I think is also very useful is work at regional level and sub-regional level. And I really would like to empower my regional and sub-regional office to be of great help to members and to help them work together. Yeah.
Thank you so much. We have another comment. Yes, Delegate of Benin. Yes, go ahead.
Merci, Madame la.
Thank you, Mrs. President. First of all, I would like to take the floor for congratulating first the Director General for the quality of her presentation, high-quality presentation. And above all, I would like to insist on the actions to reinforce the visibility of WOAH on the international scale. So these actions will allow the veterinary services at a national level to be better known, and also we won't slip through the net when it comes to some specific activities. We won't be put aside, because on the international scene we have partnerships. We do have the partners, and it's part of strategic objective number 4. So my wish is to make sure that these actions are sustained, and there's this strong reinforcement with all countries, especially what we've heard so far in terms of communication aspects. It's been said numerous times, and people, we do a lot of things, but sometimes do not communicate enough. So with the focal points on communication, we shall be able to step through this door, and so to be ahead. We can't afford to wait until the rumor starts propagating, but if we have communication experts, this will make the job a lot easier. Thank you. Thank you. Yes, I do think that we should better work with our focal points to communicate more, and we'll find out what emerges from our discussions later. But these actions should be implemented under the 8th strategic plan development.
Any other comments here? Please, Dr. Hugo from Paraguay.
Gracias, Presidente.
Thank you, Mr. President. Thank you, Ms. I am the delegate of Paraguay, a member of the Council and former president. First of all, Dr. Emmanuel, congratulations to you for your excellent presentation. As a member of the Council, well, we knew about your activities, and we would like to thank you, and we strongly encourage you to go onward, because we can clearly say that you intend to do what you had initially suggested, and you can be 100% certain that I will support you throughout your whole term. Then, remember, we're talking about the dark smoke, black smoke, and white smoke. I'd like to thank you for the white smoke that you sort of gave to our country to organize the next conference to be held in Paraguay for the next regional conference. So thank you very much, and we invite all our colleagues to come to Paraguay for this conference. It's still a long time, but it's not. But you created the white smoke to make sure this happens in Paraguay.
All very happy to come to Paraguay.
Thank you so much. Any other comments? So you can proceed, Doctor.
Okay. So let's go to the most difficult part, is the WOAH strategic plan. So the idea is to, of course, look at the future. And in the second part of my presentation, I would like to give you some perspective for the next year and update you on where we are, where we stand with the WOAH strategic plan. This plan is being shaped step by step, and we want really to catch your needs and priorities. To make it realistic and achievable, we need your contributions, of course. We need to better understand what matters to you and to make sure that this plan can put into action and monitored on the ground. We have already consulted the regional core group of all regions. We have also consulted our management staff management. And the next step of the process will rely on your engagement, all the members. And we also, of course, will have some discussion with the stakeholders and the partners. So this work will build on the achievements made so far by the organization, and thus will also take into account the lessons learned from the 7th strategic plan. So these slides illustrate more concretely the different stages of the consultation process and the building process. So phase 1 is now completed. We have defining some proposal for the strategic directions, and I will present it to you later, and working with WOAH staff, especially the management staff, and WOAH members, regional core group members. Then next phase 2, begins tomorrow. Excuse me, I am... Phase 2, yes, we will begin tomorrow, and with a process of elaborating the content of the plan and working with WOAH staff, with WOAH members, with specialist commissions. And then phase 3 will be drafting, reviews, validation, so with all our members, the different regional commission, the council, and also the different stakeholders. So we use different sources of information, benchmarking with other international organization strategies. We had a desk review of the internal initiatives, so in order to be sure that all the initiatives are going to have a transversal way of seeing things. So we have the 7th strategic evaluation. We did a survey to all stakeholders. Maybe some of you responded to our survey on which was really targeted on how WOAH give you support. And I don't have time to show you the results today, but I can tell you that the results are very good, and in general you are satisfied with the services that WOAH offers you, provide you. Of course, my vision during the election process was also taken into account. We had this basic text review, the GRC. There has been an advocacy study that maybe some of you have worked on, so we take this also into account. Communication strategies also work on gender strategy. We did a context analysis, and we had some consultations, some workshop with COMEX, CODIR, and with members via the regional core group. So we received we reviewed the 7th strategic plan, not on the result, as I just presented you before, but more on the process of the methodology to be sure that to take into account the strength of what was done and if possible, not the weaknesses. So the review of the 7th strategic plan has highlighted strengths and weaknesses, and it has helped us identify some key areas of focus of the future. We need to scale our approach to data management. We need more sustainable ways to secure funding. We need to better support and invest in the people who make our work possible. So it's very quick, but if you are interested, we can, of course, I think all these documents are available. So what are the proposed directions for the 8th strategic plan? Because as you understood well, the work is not done, it's not finished at all. The validation of the 8th strategic plan will be next year. So we still have time to work and to discuss all together. The exercise seeks for a fine equilibrium between what we must do, which is our core responsibilities, what we can do, what is realistic, and what we would like to do, so our ambition for the future. And the strategic direction is built at the intersection of these three questions. And a quick note on the term, I just want to be sure that we all understand the same things, because I will use different terms. Strategic orientation, I think it is clear for everybody. We had this already in the precedent strategic plan. So strategic orientations are the big picture goals. They reflect the broad change we want to see, the impact we aim to make. Then we will speak about enablers or facilitators that help us deliver on those goals. They sustain the organization functioning to make implementation possible. So based on the different rounds of consultation held so far, we have identified 3 strategic orientations for the 8th strategic plan. The first focus on standards, the second on capacity building, and the third on enhancing the global influence of the animal health sector. So what we propose, and we will work with you in the next months, is that this orientation will guide our work over the coming years. To support them, we have identified 4 enablers: strong governance, better use of data, human resources, and enhanced performance monitoring. And these all are essential to ensuring that our efforts have real and lasting impact. So I will go now in more detail, but quite quickly, in all of them. So develop standards that are adaptable and applicable to us. When we had this regional core group, it was clear that it is our specificity. We are the sole standard setting organization for animal health and welfare, and we hold a unique position. So we must leverage this strength And our standards are built on robust scientific evidence, shaped through the expertise of our global network and the active engagement of our members. And they constitute a unique framework to foster dialogue across countries, regions, and make informed decisions. They support trade negotiation, but also many broader issues linked to animal health, animal welfare, and veterinary public health. But standards only matter if they are used. I think that Gaston Funes said it this morning very clearly, and that is why we will focus on keeping them relevant, practical, adaptable, so they can be effectively implemented and translated into regional and national realities. Also, the survey of implementation via the observatory should remain a priority. So this is really where we want to go. It is a real core business activity. We think it is very important to reaffirm this, and that's what we heard from you during regional core group. When we say adaptable, we are not saying that we want regional standard. Huh? We agree on the fact that it's global standard that is needed. But they need to be implemented at regional level, so they need to be written in a way that they can be implemented by all regions. The second strategic orientation is around empower members towards robust animal health, veterinary public health, and animal welfare system. Again, what I present you here is not the final version. We will work together and maybe we will change some words, and it is really a first delivering of what we have heard and what we have understood. These systems, animal health system, veterinary services, are key assets to protect market, improve livelihood, safeguard global health. And they also underpin lasting trust and regional cooperation. So we want to support our members in developing systems that are efficient, flexible, well coordinated. And this system must better include animal welfare, One Health principle, and emergency preparedness. And we think that WOAH has to play a key role in fostering, not only assisting members individually, but fostering collaboration by connecting members through technical network that facilitate the exchange of knowledge and best practices. We also provide tools, guidance to help countries. And this collective approach builds trust, strengthens cooperation, and help us to all respond better to global challenges such as animal disease with a pandemic potential, antimicrobial resistance. And help countries in working together at regional and sub-regional level should be, I think, a priority. Third objective, we have discussed this a lot since 2 days, position animal health at central to tackle global challenges. As a global authority on animal health, WOAH has used its voice to influence policy, raise awareness, attract resources. This is where we want to go, the goal we want to meet. And you know it very well. Animal health and welfare are deeply connected to food system, public health, trade, livelihood, and the environment. And we work to ensure these links are understood and reflected in global discussions. And by strengthening our communication, by strengthening our advocacy, both public advocacy and policy advocacy, and working closely with members and global partners, we aim to raise the profile of animal health and welfare. So, this will help us gain support for the second and the first objective, investment, and build a healthier, more sustainable future to all. So these are the 3 global objectives. And now let's go to the enablers. So to stay effective and relevant, WOAH needs strong internal governance and external partnership. This means maintaining the quality of our operations while staying open to new collaboration and new perspective. So internally, we have launched a full review of our governance structure with the active participation of members through a dedicated governance review committee, the third time that I speak about this group in my presentation, but it is really to show you that everything is linked. This effort will take several years and will aim to make WOAH more efficient, transparent, and inclusive. Externally, WOAH will deepen strategy partnership and explore new ways to collaborate, to complement our expertise and expand its impact. And these relationships are key to staying relevant and attracting long-term support from the global health and development community. Second enabler, data leadership. Data is becoming more and more essential to support and justify decision. So WOAH's role as a global leader in animal health depends not just on science, but also on ability to provide accurate, timely, and useful data. And it is not always easy, and we have seen it these last days. To meet this ambition, WOAH will consolidate its leadership in global animal health information by advancing robust and interoperable high-performing system that supports risk analysis, transparency, and collaboration. This will help members and partners better understand risks and make faster, more coordinated decisions in the face of evolving animal health threats. Third, enablers, people at the heart of WOAH. To be honest, this enabler didn't come out from the regional core group, and it's normal. It was more something that came out the internal workshop. And the idea is that we are committed to attracting great talent, helping our teams grow, and making sure they feel valued and supported. So it is we will modernize our management policy to make our practice more inclusive, transparent, more equitable across all regions and offices. We want to build the one WOAH. That is important for us. And then, last one, performance and accountability. To make a real impact in today's fast-changing world, we need modern internal systems, processes, and policies. They are key to stay agile, efficient, focused on results, and to give credibility to especially our donors, but our members more generally. So we need better tools, clearer process, improved collaboration, break silos, ensure consistency across the organization, and continuous improvement. So we will also strive to strengthen accountability and transparency through more robust performance monitoring and reporting mechanisms. So I presented you this. Before opening the floor to your questions and comments, I would like to highlight some important next steps that will require your active engagement. What I have presented to you are the main directions, and we can have discussion on them. It's like the skeleton of our strategic plan. But now we have to work together to define the concrete actions we want to achieve, which will form the flesh, the substance of this strategic plan. That's why we will have some series of workshops which will give each delegate the opportunity to share ideas and to contribute to further shaping the strategic plan. And your input will be key to making sure that the plan reflects our shared vision. Another important thing, and we discussed this during the lunchtime with I don't remember the name, but the council which is giving advice to the World Fund, that we want to cost the plan, because it's always very nice to have strategic plan, we have a lot of ambition, we will do that and that and that, and at the end we are not able to do because it was too ambitious and we didn't know how much it will cost. So we really want for this 8th strategic plan to cost it. And to be very frank on the fact that okay, we can do it with general budget, with your statutory contribution. If we want to go further, okay, we have donors to do that. It seems that and if we want to go further, we need to find a source of resources. So I think it will be very, very interesting. It will be then also a good tool for resource mobilization, because then we are not just reacting to what donors want us to do, but we are proposing. Well, okay. So, as I said, the 8th strategic plan will be presented for adoption at the next general session. So we have not 1 year because we have to present to the council, which of course is also involved in this process, in March. So we have, let's say, 9 months. It's like une grossesse, a pregnancy. We have 9 months to work together, and our ambition is clear. We want to build it and implement it together. And so I'm looking forward, first to answer your question, but also to continuing this important work with you all. And to be clear on that we are not asking you to validate, adopt, and that. You have seen the resolution. You take note of what I presented, and we have time to continue to work on this all together. Thank you.
Thank you so much, Dr. Soubeyran, for the transparency of your presentation. So I have a request there. Oh, of course, the floor is open for comments, and we have the first one from Chile.
More than a question, I wanted to congratulate our director and her team. And I wanted to talk about some signals I've seen. We've seen that WOAH is a happy organization. And it's great to see our colleagues from the headquarters working their traditional costumes. That's great. We all loved it. And it shows that WOAH is ready to take up challenges for the future, like the challenges raised by AI, fake news, etc. But WOAH is also us, all the delegates. So I'm delighted to see that WOAH is a happy organization. Of course, there are some disagreements sometimes, but I do hope that this meeting is going to be a very good meeting and a very good time for all of us. Thanks for this very nice comment. Another comment from Colombia. Dr. Soubeyran, I want to say that I concur with everything Carlos from Chile just said. It is a great pleasure for us to see that in your presentation you used the phrase animal welfare, and this on many occasions. And this topic is here to stay. We can't talk about animal health on the one hand and then have animal welfare on the other hand. These go hand in hand. So thank you, because that's a very positive signal showing that things are moving forward and changing within WOAH.
Comments? So we now move to the adoption of the 2 resolutions as previously circulated. And I confirm here that the quorum is met. We have 107 members here. So we will start by resolution number 1 that concerns to the approval of the Director General's report on WOAH activities in 2024. Are there any objections of the adoption? No objections. And are there any abstentions? No abstentions. So as there are no further comments, no abstentions, no rejections, I confirm that resolution number 1 is adopted by the consensus. Thank you.
So thank you, and I count on you during the evening events that you come to me with a lot of ideas.
We still have resolution number 2 to vote, and it will concern to the approval of the Director General's report on WOAH management activities and administrative work in 2024. And the first question is if there are any objections to the adoption of resolution number 2. No objections. Are there any abstentions? No abstentions. So I confirm that both resolutions are adopted by consensus. Thank you to you all.
And this time, thank you. Obrigado.
So I thank our Director General for her report and for you delegates for your always engagement. So we will now move to the next session, and I have the pleasure to invite Dr. Jenny Hutchison, Head of the World Animal Health Information and Analysis Department, to take the floor. No, not yet. Okay. And so Dr. Jenny will present us the report on the animal health situation worldwide as reflected in the document that you already have with you. So go ahead, you have the floor.
Thank you very much, and good afternoon, everyone. It gives me great pleasure to present the animal health situation worldwide to you this afternoon, in conjunction with my colleague, Dr. Gilles Guillot, the new head of the Data Integration Department. So we will be sharing this presentation. Potentially. Okay, so the outline of the presentation, we'll be providing you with an overview of the global situation of animal health for 2024, then moving on to describing some of the hot topics since then, as we're now in, I did not move that, come on. Oh boy. Stay. Okay, the hot topics in 2025. Then we will talk about the summary of the impact of improvements to WAHIS, discuss, as always, the reporting situation of members, and then moving on to Gilles' area, some opportunities and challenges for data integration. See, behaving perfectly. Okay, so speaking of the global disease situation, you know that at any time you can find this at your fingertips in the WAHIS dashboards. We have the disease situation dashboard, the quantitative data dashboard, and the dashboard for surveillance and control measures. So you have that available to you at any time. And WAHIS is full of data now, 20 years of it, and it's all available to you. But to assist you, periodically through the year, the Data Integration Department staff do prepare global situation reports on 4 topics, from HPAI, high pathogenicity avian influenza, African swine fever, wildlife diseases, and aquatics. And as this is prepared by Dr. Guillot's department, I'd like to offer him the floor to provide the overview and summary of these reports for 2024. Thank you, Gilles. It's working really well.
Thank you. I think so. Thank you, Jenny. Good afternoon, everyone. I will focus on. It doesn't work so well.
Not just me.
No. So I will focus on ASF, HPAI, and collectively diseases affecting wildlife and aquatic species. ASF was reported by 31 countries or territories with close to 7,000 outbreaks, representing about 200,000 cases and more than 200,000 losses in domestic pigs. The most significant jump was observed in Sri Lanka, which is located 1,800 kilometers away from the nearest outbreaks. And finally, ASF was reported by the Philippines in the Visayan water pig, which is listed as a critically endangered species. So for transparency and global control of the disease, members are reminded to notify promptly any occurrence and to share relevant epidemiological information. HPAI was reported in poultry by 42 countries with close to 2,000 outbreaks, 6 million cases, and over 80 million losses. It was reported in non-poultry by 55 countries with 1,500 outbreaks and 11 cases in wild birds. An increased number of outbreaks was reported in mammals, slightly under 500 in 2023 versus over 1,000 in 2024. 2024 also witnessed an unprecedented spread to Antarctica. Wildlife. Regarding diseases in wildlife, 238 events were reported by 64 countries. This represented 13 listed terrestrial diseases, close to 7,000 outbreaks, 90% reported in Europe, and close to 16,000 cases. 260 species were affected, and 33 of them were classified as near-threatened, vulnerable, or endangered. It's a good moment to remind the audience of the existence of the Wildlife Health Program set up by WOAH in 2020, with the objective to develop efficient wildlife surveillance system at country level and enhance data quality. And to close this brief overview, it will be with aquatic species for which 26 outbreaks were notified, which includes 17 fish disease outbreaks, 2 mollusks, 2 crustaceans, 5 mollusks, 2 crustaceans, and 2 amphibian outbreaks. These low numbers of outbreaks have to be interpreted in the context of widespread underreporting of aquatic animal disease information. We therefore remind that WOAH updates regularly its standards and guidelines for aquatic species and organize training for national focal points for aquatic species. Jenny?
Thank you, Gilles. Now moving on to hot topics for 2025, because as you may understand, when we prepare our animal health situation report, which is in your documents, your working documents in the technical area, and I'd like to think that you've all downloaded and read that carefully, right? When we prepare that, we are working on the 2024 information that we have available, but we're now at the end of May, and so quite a lot may have happened in 2025 so far. And of course, that will be found, although it is found in the dashboards, as I mentioned before, this information is all coming from the early warning reports, okay? So I'm going to just provide an update on some of the recent activities in some of these diseases. It is working. All right, foot and mouth disease. It's been an exciting year so far. We have had the first occurrence in a zone of SAT3 in South Africa. We have had a recurrence in South Africa and Zimbabwe of SAT2, and an unexpected change in morbidity or mortality in Iraq, serotype O, and Burkina Faso, SAT1. And of course, you can see these are all the reasons for notification that you provide when you submit your early warning reports. And also, more recently, the recurrence in Europe of type O in Germany, Hungary, and Slovakia. So it's been quite the year so far for foot and mouth disease, I must say. And a new strain, SAT1, in Iraq and Kuwait. All right. I'd just like to give a quick update on those foot and mouth disease outbreaks that were reported in Europe. So it was after 11 years of absence, which is quite amazing. So Germany reported a single outbreak in January of 2025, but I'd just like to remind you all that their foot and mouth disease-free status was reinstated with effect from 14th of April of this year. Hungary and Slovakia, they reported outbreaks in March 2025, and these are still listed in the early warning module as ongoing. I do note that Hungary actually provided a follow-up, their 17th follow-up report today. Thank you very much. And I note that all is progressing well on both fronts there. And it's very important, as you can see, that the foot and mouth disease-free countries and zones remain vigilant and maintain good levels of surveillance, and that we ensure transparency and make notifications in a timely manner. You all know that. Thank you. Okay, peste de petit ruminant outbreaks in 2025. We have seen the first occurrence in the country in Greece and Hungary, and then a reoccurrence of Romania after their first occurrence in July of 2024, and a first occurrence in a zone in China. I was going to just move past that one quickly. Also wanted to talk about New World screwworm in the Americas, and this gives you an amazing picture if you compare the 2021 picture to 2024. And this had been, looking at the picture in 2021, quite the success story, hadn't it? Because it had been, New World screwworm had been eradicated from the USA in the 1960s, Mexico in the 70s, and then Central America in the early 2000s. But look where we are now. Infestation has spread to the north of this continent. We've had Panama, Honduras, Costa Rica, Guatemala, El Salvador, Belize, and Mexico reporting outbreaks, with Honduras, Nicaragua, Costa Rica, and Panama are now reporting solely through the 6 monthly reports. So to find updates for the first half of 2025, you will need to wait until their first semester report is published sometime in the second semester of 2025. Okay, so the emergency response, as we know and is reported, has been the release of sterile flies, surveillance and the control of animal movements, and awareness and good livestock practices. But it is interesting to reflect on what happened back in 2020, and I think we do see the effects of that with the COVID outbreak. I think that had a really big impact on sort of activities and the ability to conduct those routine work, which may have well have been keeping this disease under control. But it's a very interesting one, and we watch it with attention. Okay, avian influenza outbreaks in poultry since the end of last year. These you can find, as I've mentioned, in the early warning module, and we've seen the first occurrence in 2 countries, recently Brazil and Liberia, and the first occurrence in 3 zones, Hungary, India, and Lithuania, with a new strain found in 2 countries, Canada with H5N5 and the Philippines with H5N9. And again, that was just for poultry. Now I'd like to move on to a summary of the improvements with WOAHs, which is quite exciting for us all. I don't know if you remember, but last year at this time, I stood here and said we're almost ready to release the final updates of the WOAHs. And indeed, on the 4th of June, we launched those. There was the optimized 6-monthly report module and the return of the annual report module after 5 years of absence. It came back. So as of the 4th of June, we were asking you to report your annual report for 2023. And now that we're in 2025, we're asking for your annual report of 2024. And the annual report at the moment, it contains the annual animal population data, the livestock demographics. And that stuff is so important, and we'll talk about that a little bit more later. But that was last year. Since then, for the rest of 2024, we were focusing on the interconnection with EU ADIS. That kept us very busy, and I've got the next slide to talk about that. And as far as WOAHs is concerned, just the stabilization and the maintenance and enjoying its new optimized functionality and putting that to work and encouraging you with your reporting, and that's what's happened. So from 2026 onwards, we'll be looking at needs for future transformation and improvement based on your input as well, but none of this is possible without investment. It all costs money, even just running the thing. Business as usual, maintenance costs money, so just be aware of that, please. Okay, so our ADIS WOAHs interconnection, I think we have to say, has been one of the biggest success stories in working collaboratively and with care and great thought of what's needed. In summary, I think for those of you who are affected, moving from reporting the same information in two systems to reporting the information once only must have made a big difference to your lives. I hope so anyway. So the first phase was development with continual testing and integration. It moved on to joint testing, and they developed a joint management procedure, working very closely together. Then we started with a pilot group, training the pilot group, and then we put that into production. From September 2024, we started with the first 5 countries, and since January this year, it's been waves of onboarding, and the slide there says, I think 75% of member countries are basically interconnected, but as of today, it's at 80%. It's gone very, very well. Congratulations to all of you. And in the summer, September, after summer, then the remaining territories should progress to interconnection. I'd like to thank right now the EC ADIS team, the WAHIS support, project team, and the support team, because all those groups have been working so closely together to support you, and it's been really good to see, and including our early warning team, who have been tireless in their support of this information as it comes through. And just to, before I forget, the colleagues from EC ADIS are here, have been here yesterday and today, and will be here tomorrow as well. Come and see them at the WAHIS kiosk. They truly will be delighted to talk with you, especially if you have any questions. So WAHIAD has a mission. It's our own internal mission at the moment, and that is we want to improve the quality and quantity of the information contained in WAHIS. Quantity is I mean by that is just helping you meet your reporting obligations so that we have a complete picture to offer to everyone else. And quality, we work on that in a number of ways, which will become a bit clear here, but a lot of it involves talking with you to make sure that we understand what you intend with your reporting, that everything is consistent and aligned. We're engaging with a lot of housekeeping activities in all our modules, just to look at outstanding reports, missing reports, things that don't make sense. We do want to make your life easier, reducing manual data entry where possible. For instance, information that is completed in the early warning module now transfers beautifully to the 6-monthly report module. You shouldn't have to re-enter any information there. We are looking at historical data entered, going right back to 2005 at times when there have been some interesting discrepancies. And we are particularly working in the 6-monthly report module to make sure that the information that you provide best reflects the situation in your country and can be counted on by your trading partners and other members, so that it's meaningful. So we keep quite busy, I must say. All right. So we provide a lot of support for you. In a changing world, we use that to our advantage, that we have the ability to have one-to-one video sessions, and we can share our screens. We can talk you through and walk you through problems. That's been very, very helpful, especially in an environment where perhaps the frequency of face-to-face training is at risk. So if anyone wants to support that financially, do come and talk to us, because there's always a need for one-to-one training. I would just mention that we had recently, earlier this year, we had training in the Caribbean for the Caribbean countries in English, which was very successful. We'll be having training in French and English in September in Africa, and we'll be having training, I think, in November in the Middle East, more ADIS training in January, and some training for Arahis in Southeast Asia coming up later this year as well. So lots of support activities. Please use the support desk. There's a QR code, and at any time, just get in touch with us. Okay, reporting to WOAH. We're going to summarise the reporting situation of members with a comment about the value of information and how it is used, and as always, the summary statistics and talking about gaps in reporting because, you know, we have to have the information if we're going to make use of it. We're going to talk about the recent advice you will have received about the recognition of HPAI in cattle as a new emerging disease for WOAH. And then, it's related, talk about how we've improved the mechanism for reporting against Article 1.1.5. That's the voluntary reporting where we encourage you to share with us any other important animal health information. And you've done that a bit in the past, most recently a lot of avian influenza in mammals, but we haven't been so very good about making that available to you, so we're improving in that front. Just to talk about reporting and why is your information useful? Well, of course, it goes above and beyond just you being aware of the situation in your fellow countries, in your region and in the world, which you are aware of through the reports, through the early warning module and our email distribution list and WAHIS, you know about that. But your information is also used elsewhere and value is added to it. It's used in the observatory. It is used in these 4 situation reports, which I would encourage you to consult on occasion. It's also used in the work of the Status Department for supporting the information provided for you in the official disease status. And it's a good support for any self-declaration of disease status. The annual report information provides the data for the biomass calculations in animals. So it's really important there. It's also important when you are looking at another country and trying to put the disease situation in context. If you know what the denominator data is, it helps you understand just how significant things are. It's also important in the PVS pathway. How else is your information used? Well, a new venture for WOAH, we do prepare each year, you know, the Animal Health Situation Report. It has some variety of different themes over the year as one of the technical documents. But if I did a Mentimeter survey now and asked you how many of you download and read that thing, I do wonder just how that would go. Perhaps it's a good thing I'm not doing that. So this year, WOAH launched the State of the World Animal Health Information Report in an attempt to be more engaging and in a more palatable way, okay? Which I think was a great step. It was the first go at this. And I think many of you have looked at it, either online or in a hard copy, okay? And clearly you are looking at it and reading it because you did notice that some mistakes were made. I'm taking this opportunity on behalf of WOAH to acknowledge errors, to accept responsibility as an organisation for those, and to apologise, particularly to the 2 main countries I know affected, Austria and Sweden, and to reassure you all that we are putting in place measures to do better next time. It's a learning experience. I'm a positive person. I can't help but say, wow, what an opportunity to take on board the initiatives for the 7th and 8th strategic plan in terms of data governance, efficiency and agility, making our data more useful. There's a lot that we can do and we will do. So again, bear with us, we will do better. And I have to take on board the fact that you're looking at that report and pointing out mistakes, but I haven't heard anything about the Animal Health Situation Report, which perhaps I should reflect more on how we can do better with that. Anyway. Let's keep going. So, the early warning module captures your immediate notifications and follow-up reports of we call exceptional disease events. And you can see over the last few years, these numbers have been increasing. That's the orange for immediate notifications, the blue for follow-up reports. And the purple are for the no evolution reports, which is what you do when nothing's changed, you've got nothing to tell us, but you want to tell us that you're still out there, you haven't gone away, and that you are on top of what's going on with the disease. You press a button and we get a no evolution report. And you can see these numbers are increasing. Over the years, most of the increase has, of course, been due to African swine fever, avian influenza, as expected. But if I just left you with that picture, you'd think everything was great in the world of early warning reporting. It is good. The module's working well. Many of you are reporting very well. But what is not always happening is the follow-up reports. My next slide this would be the ideal situation. It'd be completely blank. if there were no reports there, no events there where it had been 2 or more weeks since the last report. Because if you remember, the code does suggest that you provide follow-up reports, how often? Weekly, until the situation is resolved or declared stable. So really, you know, it should be blank, shouldn't it? Unfortunately, it's not. We have here the numbers of events where it's been 2 or more weeks since the last report. That's 2 years of data, and you know, most of them are in the first few weeks, but there's an awful lot of them stretching out to 6 months, and there's 214 events with 26 that haven't been updated in more than 2 years. Now really, what's happened there? You can find that out. Anyone can find that out by just going to the early warning module and looking for your country, and then looking at the descending order to see how long it is since you've submitted a follow-up report. Please tidy it up. That's housekeeping. Okay, so it's 82 members, 17 of you, you know, been more than 2 years since you've updated some of these events. Maybe you've forgotten about them. If they've gone on the next page, perhaps you have. 45 diseases with 11 of them that have been there more than 2 years. Okay, we'll move on. The 6 monthly reports. You know, the last 2 years, I stood here and provided you with what I call my pink charts, which showed 2 years ago a really scary decline in the trend in reporting in 6 monthly reports. If that continued, we'd be in desperate situation now. And I have to say thank you. Over the last 2 years, the submission rates have increased. That's been great. But in addition, we have done our bit too. 2 years ago, we had an enormous backlog of 6 monthly reports, and it was a bit embarrassing. Our team has stepped up. In addition, the optimized 6 monthly report module has not just helped you, it has helped our team. And so, at the beginning of this year in January, we had a 0 backlog, none, which was amazing. Of course, you then all started submitting your second semester 2024 reports, and of course, we know, with the same number of people, it's going to take us a little while to get through those, but we will. And you can see here that compared to this time last year, the team has been able to work through far more reports, and I insist with quality, believe me, they are paying attention to that, and we've developed a new internal strategy way of working. But also your support. Our team cannot publish the reports if they have a question for you and you don't answer. So we do ask for you to be responsive. So this picture, the orange bar shows the terrestrial reports, and you can see that the decline has been reversed. I don't really count too much the last 2 semesters because you're still working on those, although they should be in. But look at the difference between the terrestrial and the aquatic. It doesn't look too bad. We can all say, oh, well, that's dreadful, maybe we should do better. But the next slide shows, I'll do it. Okay, here's a map which shows the global overview of 2024 terrestrial 6 monthly report submissions. There's 2 6 monthly reports per year, so if everybody had submitted their reports by now, the whole map would be dark green everywhere. If it's yellow, it means there's only one of those reports there. And if it's an underwhelming grey, it means we haven't received either the first or second semester report. I'll leave it there with you because I know that everyone looks straight at their own country. Please do that, and please talk with your focal points and talk to us. If we can help you, we will. Aquatic, the situation is much, much worse, except actually in Southeast Asia. They do very well there, I must say. Thank you. I have to say that. Please work on these reports. The annual report, remember I mentioned that in that we hope to have your 2023 and 2024 reports. There are two key things on this report, and that is that we have a low submission rate so far, only 50% for 2023 and 30% for 2024. If you need our help, please contact us. In good news, the time that a report has been in draft is less in 2024. That can reflect the fact that data is transferred from 2023 to 2024, reducing your data entry time, and also you're more practiced at it. But I remind you, it is important information. I did just talk with the Dr. Abila from WHO, whose passion, and I do share it, is with rabies, and she was asking us, please, please, we need this dog population data. You can provide that. You're asked to provide that in the annual report. Please, please think about that if you've got it. I do also have to talk about the aquatics. We mentioned that there was underreporting, both in any reports at all, but also, and through the early warning module, not much happening there either. but also in the quantitative data. There's only 2 diseases really for which there's much quantitative data submitted, and even that proportion of members submitting quantitative data has declined over the last 3 semesters. The data is useful if you have it. It supports the work of the Aquatic Animal Health Commission in their development of standards and in the development of the manual. It really helps them to have data. And it's used in the observatory and in the development of that periodical report. We have notification procedures for your focal points and you available in the support desk. Please talk to us about those if you actually have improvements to suggest or if it's not clear. But we work on these and we do hope that you refer to them. 2 last things from me. You will have received an email recently reminding you that any detections of HPAI in cattle are now reported as an emerging disease through WAHIS. It's all very similar. You've done it before for SARS-CoV-2. So please, if you find any, that's where it goes. Then I did mention that the other animal health, important animal health information, we have made that easier for you. We have developed a spreadsheet template. Some of you have already used it, and thank you for their use and the feedback. We have provided an option now for you to receive emailed alerts when there is a new Article 1.1.5 submission. This is a very new feature. We're just working on that. And we have built a new dashboard. I will be sending you late in June an email summarizing this so that you can consult the dashboard. It's a bit of a soft announcement now. Okay. Oh, yes. Please come see us at the kiosk. We have a crossword. If you successfully complete the crossword, you will be eligible for a wonderful prize, which is a WAHIS mug, and I'm sure you would like that. And we have business discussions in the fumoir upstairs. This year we had 44 countries sign up for those discussions. As always, not everyone attends those discussions, but they've been very busy and the team is there all week. Please come and see us. And on that note, here's my team. I'd like to have had time to talk about the work that has not been highlighted in this, that our active search team does, that the data management team does, that the admin team does, but of course there is no time. I'm going to hand over back to Gilles very quickly. Thank you.
I wanted to take the opportunity to be on this stage to mention a few opportunities and challenges for data science at large at WOAH. To do so, I would like first to remind some of the most significant changes that took place in the data landscape in the last 20 years. They came in waves, as you can see, in chronological order here from bottom to top. The first wave was the development of Web 2.0, and basically the fact that anyone since the mid-2000s can actively generate data on the internet. The second wave was perhaps cloud computing, which makes it possible for anyone to access those data from almost anywhere in real time. And the last but not least wave is certainly generative AI. So those innovations, they had at least 3 consequences. Data are now recognized as key assets by any organization. Everybody in the workplace, and even outside the workplace, has to become a little bit of a data scientist. And it is probably too early to summarize the impact of Gen AI on our world, but it's probably safe to say that it is the biggest single breakthrough in science and technology in the last 100 years. At our modest level at WOAH, data science offers opportunities to streamline and optimize our internal workflows. For example, to speed up the production of our deliverables and share data faster and more efficiently. Develop tools to become more evidence-based in decision-making. And as a public organization serving members and the public good, modern data science offers tools to operate under an open science model, which means adopting open source, open data, and reproducible science principles. And doing so, we'll be able to align better with many sister organizations and donors' requirements. I would like to close on a slightly more concrete note and mention very briefly an example of prospective project currently under discussion. and enabled by modern data science technology. And I'm talking about an AI-powered epidemic intelligence system. And in this prospective project, we envision to access and make sense of worldwide news in near real time, and read those data by crowdsourcing and be able to collect routinely additional epidemiological data via smartphones and dedicated apps, and detect and quantify epidemiological signals with AI agents, and performs accurate nowcasting and forecasting in real time. So this is this is a new data integration department, almost entirely renewed in the last year, so ready to take up new challenges. Thank you for your attention.
Okay, thank you so much, Dr. Jenny and Dr. Gilles, for this very good presentation that you made and for your positive messages, and of course to allow us to have the information to build this very good report recently published. So floor is open, and I'm really happy to have your comments. First, we have Senegal. Go ahead, Dr. Lou.
Thank you. Thank you, Mrs. President. So, first of all, I'd like to congratulate Jenny and Gilles and their teams for the quality and the fruitful report. But that said, the worldwide zoonotic situation shows many cases of foot and mouth and swine fever. These are animal diseases that are transbordering and with a major social, economic impact. So on their propagation, its persistence is part of the challenges related to vaccines and vaccination, which were discussed lengthily at a certain length during the forum. Regarding the emergence of different Coquillomias outbreaks, I'd like to specify that in Senegal, it's Kilzomia bezenia that was reported, and I guess it's probably due to climate change, but we're not sure. And congratulations for the amendments made to on the Code of Terrestrial Animals for the emerging miasm for WOAH. We congratulate you for your new developments, for the 4 developed modules, and congratulations for the training of Poifoco, what has been planned in Abidjan for the month of September. And I have a question for this. When will there be interoperability between WOAH and WAHES of African Union? And regarding the weakest points in the surveillance of wildlife and monitoring and the diseases of aquatic animals, I'd like to encourage WOAH to provide more support to the countries as part of their monitoring efforts. Thank you very much.
So much. Answer now if you want, or you want to wait for more questions?
I'm happy to take the question, and that doesn't help. In particular, addressing when will there be interoperability between ARIS and WAHES. We have been actually trying to chase people for a meeting to discuss, better understand the needs and to have a discussion with that. And if you are here at the general session, I encourage you to meet with me and my deputy, Peter Mellons, so that we can talk about that. You know, it's on the radar as a need, but we do need to understand the situation well. Thank you.
Thank you so much. I have a request from Australia. Please go ahead. The floor is yours, the delegate.
Thank you. Australia commends WOAH on its work undertaken to update the World Animal Health Information System. The reporting system has provided WOAH members with easy access to information on animal disease outbreaks and supports WOAH's mandate to promote transparent reporting on animal disease status. Improvements to the early warning module and 6-monthly reporting have notably improved the ease of use. Australia thanks the World Animal Health Information and Analysis Department and the WAHES Support Desk for their ongoing commitment to bettering animal disease reporting globally, and for their excellent communication with animal disease notification focal points. Thank you.
Well, thank you for those lovely comments. Australia.
Thank you so much. Now, Poland, please, the floor is yours. Please, the micro.
Thank you, Mrs. Chair. I speak on behalf of 27 member states of the European Union. I would like to thank WOAH and Dr. Hutchinson in particular for the work done by her and her team all year around to ensure the global transparency of the animal health situation. With this intervention, I would like to focus on 3 diseases: lumpy skin disease, African swine fever, and foot and mouth disease. On LSD, the continued reoccurrence and geographic expansion of LSD with outbreaks in our neighborhood underlines the fact that LSD remains a significant transboundary threat on the global scale and continues to pose a real risk for the European Union. The EU wishes to emphasize the importance of the coordinated regional approach and joint efforts on vigilance, preparedness, timely reporting and transparency that are essential for early detection, prompt response, and to prevent further spread. Mass vaccination using highly effective homologous vaccines remains the cornerstone of LSD control and eradication. The successful experience of LSD eradication under GFTATS in the Southeast Europe a few years ago demonstrate that when vaccination is applied strategically and consistently in a coordinated way at the regional level, lumpy skin disease can be eradicated. The EU remains vigilant and prepared for support and collaborate on the coordinated control measures to combat LSD. We call upon all WOAH members to promptly notify lumpy skin disease occurrence in WAHs to ensure timely response by neighboring countries. As regards African swine fever, the EU confirms its support to WOAH warning statement on the risk involved in the use of substandard African swine fever vaccines. The EU shares WOAH view on the importance of using only high-quality, effective, and safe African swine fever vaccines once they will be available. This is why, to the date, no African swine fever vaccine is authorized, nor is not authorized in the EU or in any EU member state. Therefore, African swine fever vaccines cannot currently be used in the whole territory of European Union. As regards foot and mouth disease, the EU would like to provide an update in relation to the technical working document, Animal Health Situation Worldwide. Since that report, you said it already, since that report has been issued, important events occurred, as has been highlighted in our side event on FMD yesterday. So I would like to reiterate that first, Germany eradicated foot and mouth disease and regained the WOAH official status FMD3, where vaccination is not practiced. for the whole territory of Germany. Second, no outbreaks of foot and mouth disease occurred in Slovakia and Hungary since 17 April 2025. Reinforced surveillance and measures in place indicate that are going towards to eradication of foot and mouth disease also from those EU member states. We should recall that EU FMD regionalization put in place allowed us to contain the disease and prevent its spread. The EU will continue to communicate with the EU trading partners in a transparent manner. In addition, I would like to recall that another continuous risk that we recognize for the EU is a consequence of unprovoked Russian aggression against the Ukraine. This senseless and brutal aggression by Russia jeopardized the application of the proper animal health measures in Ukraine and therefore irresponsibly increases the risk for animal disease outbreaks in the neighborhood and beyond. Finally, let me say a few words on Aedes. The EU would like to thank WOAH for enabling the link between Aedes and WAHIS, thus reducing the administrative burden for the EU competent authorities and ensuring data consistency. The process was laborious, but we always found in WOAH open doors and willingness to find the common way forward. This needs to be acknowledged. Currently, out of the 40 countries that use Aedes, 32 already use Aedes as a single entry point for both WOAH and EU notification purposes. The process is not over, with still a steep learning curve ahead, and we will strive to improve the Aedes-WAHIS connection to make the work more efficient and reliable. Thank you very much.
Thank you very much for those comments.
Thank you. I have a request now from New Zealand. The delegate from New Zealand here in front. Here.
Thank you. We thank WOAH for the ongoing work to improve and modernise the data systems. In addition, New Zealand, Australia, Canada and the United Kingdom join the European Union in condemning the unprovoked Russian aggression against the Ukraine. In addition to jeopardising animal health, this has had severe negative consequences for animal welfare and global food security. We are committed to strengthening the global rules-based order to support a peaceful and prosperous world. Thank you.
Again, thank you for your comments.
A request. Guyana, yes, please, you have the floor.
Thank you, Madam Chair. I rise on behalf of the members of CARICOM to thank WOAH for the recently held training which we received in the Caribbean. That training was very, very valuable for all of us. It was a refresher for some of us, and it was new for some. And I'm happy to report today that approximately 60 persons benefited, and even some members some countries who are not official members of WOAH benefited. It is our hope that we will continue, and we have already started that discussion. We're going to continue to work to have those other countries be a part of the WOAH family. Thank you.
Thank you for those words concerning the training. My team will be very delighted to hear that, and I always like to hear the feedback. It helps us to know that we're doing our job well. Thank you.
Thank you so much. Any other comments from the floor? I can't see any, so thank you, Dr. Jenny, Dr. Gilles, for your excellent presentation. And now it's time to have a break. I can see that you are tired. 30 minutes break, and I hope that you come back here at 4:30. Thank you.